Muchas gracias a todos quienes nos acompañan y a quienes se están conectando en estos momentos. Bienvenidos al tercer Congreso Internacional de Salud Mental, Corte de Caja y Futuro. Seguro de que todos estamos aprovechando al máximo y aprendiendo de los destacados expertos que nos acompañan. Quiero informar a todos los ponentes y al público en general que la interpretación simultánea en inglés y que pueden acceder a ella cliqueando en
simultaneous interpretation in Portuguese and English. So you need to click just in the earth glove bottom of your screen if you need interpretation. And continuing with our program, it's an honor to introduce you a very interesting people on mental health, Dr. Palacios Jimenez, who is a doctor in psychiatry, and it's the IMSS coordinator of mental health and addictions. Among its trajectory as doctor, he has managed
Instituto Mexicano del Seguro
of the mental health in the Mexican Social Security institution.
desde el año
It's
2021.
also important to mention that she has been working in the Social Security Institute until today. The doctor has also been involved in the coordinator of addiction and mental health in the Mexican Social Security. The doctor will be taking place in this panel to talk about the
Muchas gracias, doctora.
new strategies for mental health in the panel.
Sí, saludo con mucho gusto a
Thank you very
todas.
much, and I send greetings to everybody that is here with us.
Es un lujo.
Thank you very much to have us here. This panel discussion is very important to have it, and I will share, or I will introduce Dr. Renato Olivera. Dr. Renato is
tiene posgrado en psiquiatría
teacher in London. He has a psychiatric major,
por la Universidad de Sao Paulo.
and he's a psychiatrist.
Oliveira es jefe de la unidad de salud mental
Doctor is the chief of mental health and substance use unit of the
en Washington. Y bueno, pues el
WHO in Washington, D.C. The doctor has a wide trajectory in the definition of the quality. He has also worked very hard to coordinate with different people designated to elaborate the new agenda.
doctor.
So it's an honor, doctor, to have you here again, and you have the word. Please, go ahead.
Muchísimas gracias, doctora Norma. Un gran placer
Thank you very
estar acá
much,
con ustedes.
Dr. Norma. It's an honor to be here with you.
Conversaciones como esta con
It's an honor to have this kind of conversation
acá en esta
with
conferencia
Mexico
¿Ustedes me escuchan bien?
in this international congress.
Perfecto.
Could you hear me well?
Acá una
Yeah,
presentación.
perfectly. I have a presentation here. Let me share it with you. Just give me 1 second.
Ok. Ok. Vamos a empezar entonces. La idea hoy
Okay, let's
este
start.
panel sería traer el
The idea of today's panel is to bring up to you the information about the improvements that we did with the mental health
recomendaciones principales
WHO institution, and also the main recommendation that this organization gave us
de las recomendaciones
in order to achieve this new recommendation of this commission, introducing in the politics and strategies for all countries.
tiene algunas
The presentation
antes
has
de
some topics, and before talking about the work that the commission has done, I would like to make like a brief introduction.
traer alguna información sobre de la pandemia
The
de COVID.
Americas, and also to have to explain the impact that this has caused in our people, and I'll speak about
de qué
detailedly about the the work that the Commission has done. For example, what we think about the PAHO and the implementations in our countries. I'm sure that you know the mental health load in the Americas, because when we compare the mental health problems load related to the substance abuse problems, they related to suicide. And the reality is that we have a third part related to these conditions. So it's a very high load that we have. And when we compare this load with the disabilities that this mental health causes in relation with another illnesses, we can observe that we have different mental health issues that are like uh, the that are guided, for example, in depression figures, or it also can cause back pain. We have anxiety disorders or drug consumption disorders that have higher figure because of the different substance abuse in our region. And to complete this picture of mental health in our regions, I couldn't, uh, or I need to mention the suicide problem, because we have a suicide rate that is increasing uh, during the last 20 years. We have, unfortunately, some countries that have this death rates because of suicide in the higher place in the world. We are on those higher rates. The other regions are, let's say, stable, but it's an important healthcare, public healthcare issue, because we have around 100,000 deaths because of suicide in the Americas region. It's also important to mention another aspect of this mental health picture, which is the coverage for the treatment. And this data that you have in the screen, it shows two things that are found. One is the low coverage, because one out of five people with a psychosis have access to treatment, mental health treatment. But if you see in this screen, you see that there's an 18% of the psychosis coverage, and we have the number six, because only six out of the 35 countries sent information about the coverage on the last survey of the World Health Organization. So we have two problems here: the low coverage and the lack of programs, but also the data and documentation lacking are very important as a problem, because we are not able to have these quick surveys for mental health issues. Also, among with these, maybe you could think that this a problem. If a problem has a higher impact, the answer should be also that important. But this is not like that. The average, the regional average, is of 3% of the total budget on health, which doesn't match the issues that we need to face daily. And as everybody knows, sometimes these resources are not spread as the most efficient way, because these resources are spread mainly in the main countries, or for long-term institutions that are not close to people, to communities where people could have more access to it. Unfortunately, a lot of these long-term institutions are
abusos de derechos humanos.
institutions where the human rights are violated related to people's mental health
Para,
issues.
para que podamos
Also, it's important to mention and to talk about this. It is important to bring it to the table to improve the situation that the COVID-19 pandemic didn't help us in anything related to the problem load, because we all know that
el impacto de la
everybody
de nuestras poblaciones.
face these COVID-19 pandemic problems. Also, there are people more that have a higher impact or that are more vulnerable to, or were more vulnerable to this. But the figures show an increase of anxiety, depression, and among uh, there were a condition which is called post-COVID-19, which brings with it a different neurology issues or psychology issues that contributed to the mental health problems to the people.
Junto con esto,
And
juntos con la OMS,
among with this, we work with the WHO, different surveys during the pandemic to comprehend how the health services were responding to these needs that were increasing in terms of mental health in different countries. And
muchas veces
in reality, we discovered that
que existían no más
a
funcionaban
lot of time the healthcare services weren't working
de la pandemia.
because there were a lot of services of mental health during the pandemic
Obvias.
that weren't working currently. And the causes are pretty obvious because sometimes people didn't have access to it, or it was difficult to go outside, or
Muchas veces
the
también
mental
los
health
cerrados,
services
personas
weren't accessible because they were closed, or professional doctors, etc., were transferred to other areas.
de
We
aumentar escalonadamente
understand the need of
una infección
improve
de gran proporción como COVID,
and,
pero
for
claro que también
example, with this COVID-19 pandemic, but
servicios esenciales
also
no,
the mainly services, if the mainly services are not working, this could cause us problems for the people that need the most. And there are studies that show that there were hard periods during the pandemic where these mental health issues were
pudieron tener
higher, or maybe people that were on a treatment, they weren't able to continue with this treatment.
mencionar también
We cannot
de nuestras
let
poblaciones.
outside the climate change and the effect that it has in our mental health, the changes that our planet is facing, the migration increase, and the increase on the natural disasters. This has also a mental health impact, and we need to be prepared to respond in the most accurate way. Since the pandemic started, we start working to help like stronger or with better programs to people. We started on the PAHO with different programs. We have some examples here of different activities that the PAHO has implemented. We make a hierarchy of different courses, virtual courses done by the PAHO in order to the countries to have access to this material or to this information for psychological treatments or for people with mental health, for example, the MHCAP, or also different communication materials so the government or organizations to have access to different programs or information to improve the response on mental health issues. Among these, There were important communication campaigns that were done. For example, the stigma campaign that was mentioned as an obstacle, as a challenge for people to reach the information. We created a huge campaign in social media for the stigma, and a lot of countries incorporated also. And we incorporated in the communication strategies for mental health institutes. We had very important numbers in terms of access to what we created and the different materials, always bringing the important aspect that is making the people with mental health feel uh, more free about their problems, and the population could feel also free for these mental health issues, because people need to have access to it. And a lot of mental health people with mental health issues don't have access to these, but they have the capacity to work its disorders and to work the daily activities. So we try to change the perspectives, the scope, the negative scopes that we're thinking about mental health in a lot of regions around the world. Here, this is just an example about the different courses that we have, virtual courses that we have in mental health field. This is just a few of them. The people could have different courses to get different certificates in different mental health, public mental health areas. But this is very important for different countries to step forward in information capacity in mental health topics. And I also would like to talk to you about the creation of the High Class Mental Health Commission by the PAHO. This commission was a strategic opportunity to extract ministers or experts from different areas, not only working with specialists was the scope by the PAHO, but also to include scholars, mental health professionals, and also people with lived experience to discuss about this. So the PAHO could speed up the processes or the progresses in mental health matter. We had the opportunity to have the ex-president of Costa Rica and Nestor Mender, which was an ambassador of the American States Organization, which were the leaders of this high-class commission. The works of the commission were divided in three parts. We worked together with the commission in three work groups that we thought that had the most priorities to start or to think about the different ways to improve the mental health. The first is the alliances, political priorities of mental health in different politics. Or the idea here is basically to expand, to spread the idea of mental health, to bring up different areas of how to improve the mental health in different government areas, because as I told you, the financing of mental health was or is very low, so we need to raise uh, this financing of mental health. And if we could make more investments on issues that are very key for mental health, but also for the social issues, unemployment, education, etc. The second work group was meant to work about service presentation, because I mentioned the low coverage to you, that we needed to increase the mental health services. So the second group was working on that, and the third group was working on social determinants or economic determinants related to mental health issues or mental health population. The commission work also also did different reunion meetings with the different representatives of important groups, for example, indigenous groups or young people, women, immigrants, because they are very important to demand, but we also work with different professionals in education and techniques on mental health. We launch at the end of 1 year of work the report, which is called a new agenda for mental health in the Americas, with the objective of bringing these questions into the high level governmental institutions. The report have 10 advantages, 10 recommendations, and you can get it on the page of the PHO in English and Spanish. It is also a summarized document of this in different language, for example, French, Italian, etc. Portuguese also. So we're going to make a recap of the recommendations. For example, the increase or that we need to increase the mental health or the influence or the importance of mental health in different government action areas, and with this to implement different strategies or perspectives, but in different politics in the government, because we want as a result to increase the financing on mental health sectors, but also to improve the quality or the quantity in terms of resources for strategies that we know that they have a higher impact, higher efficiency, because it can give us something more important. We also want to ensure the human rights in terms of mental health. This is very important. And here we have the element of this institution, because these institutions were so present in different countries, but also the laws related to mental health are important, because we have some terminology that is old terminology that we need to conserve and protect the human rights of mental health people. So those laws were created a lot of years ago, have different perspectives, contrary perspectives as the ones that are currently. Because before we didn't know that this need was needed to implement and to protect their human rights. Also, we want to protect the life of mental health of people with mental health disorders. We know that these mental health issues start during childhood, therefore we need to have this perspective to continue. Also, we want to implement the effectiveness to make more strategies. We want to, or we need to focus on the prevention focus. We have another scope that it's important, a scope that will transform the mental health programs, because we know that the vast majority of issues are faced on different communities. So we need to have specific strategies to give support to these different communities as different determinants of mental health. And the last recommendation is also about
dados, que la información
the implementation of the information of the data,
específicas con sus
to break down the data
que tengamos
so everybody can
más
have like
actualizada.
more dynamic and updated information.
Esta presentación no podría dejar de mencionar también que
Getting closer to the end of this presentation, I need to mention that in the PAHO, we're working together with countries to transform this vision from the high-class mission in a strategy for regions to prevent the suicide in the Americas region. Members of the PAHO signed the agreement of improving with 6 strategic lines
regional que esperamos
for
pueda
the new regional strategies that we're hoping that this will help to countries to prioritize specific areas for mental health and suicide prevention in America. And just to end this presentation, I would like to end up with 3 points, 3 important messages, so we can move on with the objectives that we have mentioned. We need to improve the mental health, but also the priority of these mental health resources, not only for the importance that this mental health has, and also because we need to have like mental health institutes as a priority in our region. Among these, we need to put more resources. We need to give more information about prevention and treatments, and also we succeed on improving these that are important to bring mental health to the body and to place it in the exact right place. Among these, we need to implement the knowledge about mental health in our communities and in our systems and health.
Que personas con experiencia vivida hagan parte de
It
todo
could
este
be with experienced people that could help us with this
mucho la
transformation. I
atención.
thank everybody here. It's a pleasure to be with you here, with my colleagues, my friends, Mexican colleagues and friends. Thank you very much.
Muchas gracias, doctor Renato, por este panorama que nos acaba de compartir. Y importante el énfasis que hacen las 10 recomendaciones que emitió el equipo de la Comisión de Alto Nivel sobre Salud Mental y COVID. Ahora me voy a permitir presentar a nuestra siguiente panelista. Es la doctora Evalinda Barrón Velázquez, a quien saludo con mucho gusto y agradezco.
Now I am presenting our next speaker, Dr. Evalinda Barrón Velázquez. She is a psychiatrist in high specialty geriatry. She has some masters in public administration and public sciences. She had different responsibilities at the federal government level. She coordinated the national strategy for drug prevention, and she was the director of CONADIC, and currently she is the general director of the National Commission on Mental Health and Addictions. With this change of in the structure, she is now with that title, and we are welcoming her. Thank you very much, Norma Magdalena Palacios. I am going to present the progress made by Mexico regarding these recommendations, and we are really very proud because we started to work in the whole transformation of the mental health program for this 2019, since this for transformation government started, knowing that in order to have a mental health, we had to change the conditions of the country. So part of this fourth transformation is to reach the people mostly in need, first the poor, and it has been the topic that had affected us along the history, because those are the things that we have suffered, and changes were complex. And the mental health system in Mexico was entirely abandoned, with a teaching for psychiatrists, for doctors, in which mental health was access to treatment, but it was just a privilege, as a privilege. That was one of the main points of Dr. Jose Varela for the whole sector. I am going to share my screen to start my presentation. Can you see it? Yes, we can. I have to change something. Can you see the entire screen? Yes, we can see it, but if you want to put it in a complete screen, go ahead.
¿Y eso cómo lo hago?
How do I do that?
Control F5.
Control F5.
No.
No, I can't.
En la parte inferior
Or in the
de la
lower part
diapositiva aparecen
of the slide, you
varios
can
iconos
see
pequeñitos.
different small
Ahí hay uno
icons.
donde nos dice presentación en diapositiva, que es el de la derecha.
Then you have the presentation as a slide on the right side.
Sí, por fin.
Ahí va.
Can I help you, Mom? Yes, please.
Allá, pero ya se ve así bien. Sí. Muchas gracias.
Okay, thank you very much.
Muchas gracias.
Thank you.
Bueno, entonces, a partir de esto,
Okay, based on the historical abandonment of mental health and its care in the hands of only an elite class, where care was just a privilege, then we had to do this restructure. And the health sector had it very clear. It was one of the main indications. Fernando is sharing the screen. Please let us know when do you want the next screen.
Gracias.
Yes, thank you. Okay, next one. Okay. Dr. Juan Manuel Quijada Gaitán already explained how was a Mexican model for mental health and addictions. First, it involved a whole change in the management to define a supranational direction, and that was essential because it was affecting only the economic resources and how they were distributed in the states, but how the models were implemented at the state, municipal, and local level, and with the community communication. And the second one, to be centered on the primary health care. As Renato mentioned, it was a center on the psychiatric hospitals. In our country, we have only 35, and they are all forgotten. They are unfragmented. Then to have the technical competencies on all the health caregivers, and the third part, which is so complex, intersectoriality. In order to have a mental health, we need a social justice. We must have equality in rights, and for that we need to work all together at all the government levels, and that is quite complex when each one of the ministries and each one of the institutions have their own attributions. Next one. To that extent, I'm going to tell you a little bit how we did on those 10 recommendations of the WHO. As I mentioned, we are very glad to do our homework because we did a lot of progresses. So the first recommendation that was to increase the mental health at the national and supranational level, where it is very important to define it as a priority. And number two, try to mental health within all the politics and as well as in all the sectors and in disaster emergency. And the third one is to increase the amount and improve the quality of mental health financing. That's something we work from day one. The changes in the general law on health, on mental health and addictions, where we are working together with the legislative power and supported by the presidency and from many other civil society sectors. We made that change to the law, mostly Article 72, that talks about these topics that were a priority within the health politics and to be implemented according to the institution and according to the international treaties regarding human rights. First of all, in this part, we are talking about human rights. Then, it makes it so important, but at the coordination level and at the public policy level, we started to work from the 2019 on this strategy to prevent addictions. It was a strategy of mental health and to prevent addictions involving to have this coordination intersectorial where we coordinated with all the state ministries. We made 32 tables because we have a federated country, and each one of the heads decided in more than 32 municipalities that made possible to reach almost 1/3 of the population. But what is interesting is how we made the intersectorial coordination to rule this item and from the financing that were not just vertical financing for each one of the ministries. How do we do that? The financing that are focused for culture, education, and the sports work also as a protection factor to perpetuate the mental health. As this government is the one that has been mostly investing in social programs, mostly for the young people, it became a structure that is encouraging public policy far beyond the transversal or cross financing that we had. Next one, please. significant mechanisms, because in this way we will be able to make an approach and a recovery process, including on-time rehabilitation. Likewise, the strategy is also intended to data management, because the program must develop some variables allowing the analysis of data, specifically on mental health. Right now, the Health Ministry has a data management system associated to illnesses, and it will be developed, but the recording of illnesses associated to mental health is not well recorded. So we must include all the variables that will allow us to make an analysis, and based on this analysis to make an operating plan to continue promoting mental health integrally in all the life of the people. In this access, we are also looking to promote investigation regarding mental health in such a way that we may get some information, scientific information associated to mental health, specifically for Guatemala. Axis number 3, which is for mental health regulations, intended to promote a mental health law. In this case, it may be well associated to the recommendation number 1 of the new mental health agenda, to make it at the supranational level. In this institutional policy for mental health, we will develop different topics associated to the recommendations of the agenda, but that has a long process. We need to do a better analysis about the mental health in Guatemala. And this will also promote mental health, both in the people and the communities, taking into consideration the community features. The regulation on mental health also include a mental health program intended to do everything to develop skills and the staff that we currently have in the country. As I mentioned, we have 22 municipalities and 340 departments, out of which currently we only have professionals, only 5 or 7 in each municipality, so we have to promote the training of these professionals regarding the mental health system in order to promote this mental health law. In this strategic access, it proposes mechanisms and action lines that may be summarized in encouraging or strengthening of coordination inter and intra-institutional. It is important to mention that the creation of this policy for mental health is also associated to the efforts made by the ministry and by the Guatemala regulations, as well as other non-government institutions and even international institutions that made a contribution to create this policy. The other mechanism is to make an integral approach of mental health, considering that the main axis or the first axis is associated to the psychosocial part. This approach of mental health, we talk about the interaction, poverty, included in the care policy. This integral approach is both at the community and the state level. The next line of action will allow us to make an analysis of the data that would help us to make a better decision making at government level, positioning the mental health in the different fields. Then we must generate scientific data on mental health, considering that in Guatemala we have very little research on mental health, and also associated to the very little information that we have on mental health, and also as well as the political conditions in Guatemala. Then to develop human resources so that this care of mental health is integrally at all the levels in order to provide a benefit to everybody where we are developing these actions. Finally, we also have a challenge on this mental health policy in Guatemala, because first, this is very recent. The presentation of this policy is very recent. And second, to find the mechanisms, considering that the mental health staff are 213 psychologists in the country, and the professionals on psychiatry is very short. 23 are in the mental health hospital in Guatemala. So we have the challenge of implementing this mental health policy in Guatemala. By incorporating more human resources in the mental health program in Guatemala. Here we have another challenge, and it is to find a way to make an alliance, a strategic alliance, and to find the strategic items where the society or non-governmental entities can be incorporated to participate in different levels in this institutional mental health policy. Thank you very much for your attention. Thank you very much for your attention.
Muchísimas gracias, licenciada Ana Cristina Mendoza. Bueno, pasaríamos al siguiente componente del panel.
We will move on.
Que nuestros tres panelistas que nos
speaker of this panel discussion, I would like to have our three prior speakers so we can ask some questions that have
Me gustaría
come
preguntar al doctor Renato Oliveira,
presentations, and I would like to ask
financiamiento
Dr. Renato Rivera,
para aumentar
what
los
mechanisms
fondos
of
destinados a la salud
financing to
mental
improve
son los
the
más
funds
exitosos.
designated to mental health are the most
Usted,
successful.
su
We would like to
platicando pues la
have
relevancia
some
de
examples shared from you
con esta
based on the
revisión
relevance that you
que
were
han hecho
talking about,
antes, que nos pudiera
based on
señalar
this
cuáles son los más
description and what the countries have been done. We would like to know what are the best mechanisms to get to those financing programs. Thank you very much, Dr. Norma. And I think this question can be answered
Uno
upon
sería
two perspectives. One would be the way of how we can bring up more funding.
nuestra región
And the experience that we have in our region
en dos partes.
is divided in two parts. The first of them is that,
Como yo mencioné en la presentación,
as I mentioned in the prior presentation,
la autoridad más alta
authorities, governments, for example, presidents or prime ministers, they decided the different government areas or ministers can contribute to improve mental health. In this way, for example, the contribution to expand the health services, all the technical part could be improved, but the disinstitutionalization process, for example, there are a lot of people that have been working or using these institutions. The responsible minister for these social sectors contribute with a percentage to these people so they can have a home to live in. Let's say a home, a shelter, etc. Just to
de promoción y
enhance the example, all the prevention and promotion aspects start on childhood, so the education secretariat can contribute to the expansion of these
de la
services integrated on schools, or we can also improve the sensibilization of mental health in society or social emotional institutions for children and young people. So this is a scope, a perspective, how to bring out um, more funds. And the other one is how to create investments and allocate the funds based on the results. We also have some examples in the region where the government is working with the different general health institutes to integrate the health institutes together as an expansion of the coverage or of people in different treatments. So we have different goals, and based on those goals, the finance fund is allocated. So we have some concrete examples so we can increase the funding. Also, we have different aspects about how we can increase the financing part. Those are more focused on
la mezcla de
the
diferentes
capitation, as we call them in English.
tengan una perspectiva de salud.
Also, we have different payment mechanisms in public health, so that public health could cover all the needs of a specific population. And also, we need to be careful of not having less investment in certain populations than others. For example, people with a higher mental health disorders, where the treatment could be expensive, more expensive. So we need to focus on both the scope of the payment mechanisms and how we can uh, cover the general needs of different population groups in what we called catchment areas. I don't know if your answer was, if your question was answered, but basically, those are the scopes, the perspectives about mental health situation.
Gracias, doctor. Yo creo que sí nos dio amplias
Thank you very much, doctor. I think you gave us a lot of possibilities, and there's another question that is been asked to Dr. Evalinda.
En la recomendación,
Doctor, in the recommendations of for the new agenda, one of the recommendations is to integrate a response to disasters and emergencies. And based on our experience as a country, uh, due to the impacts of Otis hurricane, the question is,
de México que
how
tenemos
could
hasta
you share with us the experience in Mexico based on this hurricane disaster? Yeah, that's an interesting question. And basically,
y en específico en la
the technical group for health, or specifically mental health,
creo que siendo
was created
pues,
on the pandemic.
el temblor del
And I
2017
think
en la Ciudad de
after
México,
the experience of 2017 earthquake on Mexico City, I think we received an organized response
pues iba a
for
ser
mental
algo
health situations,
y
because
tener una
we knew
respuesta
that the pandemic was very
bastante
complex. So we had a pretty accurate response, and we were able to build up
a nivel
a
entonces
set
para
of capacities,
que hemos
uh,
tenido en México
online capacities. So in this case of the hurricane in Mexico, we
con trabajo
we
muy
faced this challenge with a lot of experience. So we were very ahead about what was about to happen and what we were going to need. So we needed to think about the first
que
difficulties or challenges in terms
tuvieran
of patients or that
diagnosticados que tuvieran
have
alguna exacerbación o personas sin
have
diagnóstico que
a mental issue, or people without a diagnosis that could experience some systems that needed to be helped. And we also experienced a very complex and difficult scenario because we were working very hard on the reconstruction of the
después de trabajar
social
muchísimo tiempo
security system.
viene
And after being working a lot of time, we received this disaster, tremendous disaster,
estábamos viendo allá por
and
la Secretaría de Salud
to all of the public
y
service, it was like
justo
a
sabiendo
huge challenge because we needed to
que salud
build up
era
a action
el
plan
trabajo
because all the
intersectorial y
sectors were damaged,
de los
and
estados
the
para
intersector and intrasector
salud y
plan
salud mental ha sido
were built
maravilloso.
up based on
Muchos
the mental
estados
health
una súper
sectors,
sabiendo que el
and
personal
their
del
response was
estado
pretty
está en
awesome
una
because
situación vulnerable
even when
y
we know that the government is
no esta
uh,
primera etapa en donde
pretty
sabíamos
vulnerable, we are
medicamentos
responding
y
by
pueblos
stages. This first stage, we knew that we needed to provide
aparición
medicines,
más de trastorno por
and
estrés
currently we are
ya
on
con
the
una
stage of
instalación
post-traumatic
de
stress
servicios en la comunidad,
stage,
en los
with a,
centros de salud, en puntos fijos en donde las
we
personas
have some
atención y con la
key
atención
points where
psiquiátrica
people can go and have
desde los estados han
an
cooperado
appointment
para
with a doctor so they can receive
la
help.
salud mental va a ser largo
Also, we know that the response of mental health will be long,
con el
and
aumento
this will have to be all
psicoactivas,
related to
entonces
the
que
increase
ir
of
implementando acciones conforme se vayan dando estas
substance usage. So we will
de mucha
have
hermandad
to
y
implement different stages beside it.
que
And
se
until today,
últimos
we
años
have been
ahorita
working
en tiempo real
together, and the results have been pretty great. We have
de salud
done a
mental
lot of improvements in Acapulco, Guerrero, so it can rebuild
parte importante
itself quickly. Another important part here that we have been working since the pandemic is to take care of the ones that take care of us.
en pandemia
And
y
that's why we are trying to improve the
pasado mucho tiempo la
health service system, because it has
siendo
been
ellos mismos
burned
damnificados
out since the pandemic. So in this disaster, we also need to take care of the ones that take care of us during this process, hurricane. And it is also important to remember that
de Acapulco, no
to
solamente
build anything, we need to build the social tissue, and not only in infrastructure, but also in welfare and life building. So that would be also important to build, again, the mental health situation of the people of Veracruz. Thank you very much, Dr. Eva Linda.
Como sector,
And definitely, it's a big challenge that we have as a sector. And I think that we have been able to develop a good job in this topic specifically. Now, I would like to ask to the graduated Mendoza,
para sensibilizar
how or what has your country done to help many co-workers in these mental issues
existir.
to break these barriers or
Para el personal no especializado,
challenges that the
tema que hasta hace
non-specialized people
años era medio esotérico.
can bring up something.
De verdad lo digo así porque
And
parecía
I'm saying this in this way because before it seemed like something critical and something very tight.
región y
But
en los
based on
países
this new model that we are improving in region and the countries that have been successful, where we need to
especializado, pues ¿qué ha
gather
hecho?
with the non-specialized and specialized people. The
Rompiendo
question is, what has Guatemala done to break these boundaries?
A partir de esfuerzos tanto intrainstitucionales como
Talking about efforts among institutions,
En este momento puedo poner
we have done, I can give you an example related to an intervention and a specific intervention that we did on childhood education on the psychological healthcare
para la población
services for the population as well as for the population and in general health. And mental health, it's like a taboo topic, if we can call it like that. And in this sense, we have tried to look for
relacionada
this
a
personal of childhood education to be related to the psychological healthcare systems.
un enfoque también de
This has had a scope of interculturality,
tiene
having in mind that the country has four existing cultures, Maya, Gaelka, among others.
eso ha sido acompañado de la
And this process has been held by different organizations, for example, the PAHO, and others that have tried to bound the different cultural elements or philosophical elements of the cultures with the science of mental health to enhance and improve the mental health experts to implement this.
Muchas gracias.
Thank you so much.
De acuerdo, me gustó esto que
Very important.
desde la cosmogonía. Creo que es un
I
punto que
liked what you pointed out. I think it's something that we need to consider.
otros aspectos
Besides
tienen que ver
the technical part, we need to bear in mind different aspects related to culture and social aspects.
en lo comentado. Adelante.
Dr. Ronaldo, would you like to add something?
Norma,
Yes, I would like to add something, Dr. Norma and Dr. Cristina. And if I can add something, I remember that I had a teacher on mental health, an excellent psychiatric on my country that told us that mental health was very precious, just to have it on the hands of the specialists, for example, psychiatrists or psychologists, because everybody can make anything to improve mental health in their families, in their homes, in their communities. It's obvious that we have different levels where different people or professionals can make something different, but there's always that can be done. there's always something that can be done. So I think the knowledge transference for the different people, the different areas of opportunity that we have, not only on health, but different areas outside health, it's very important to have the mind to face the different topics that we discussed in this panel discussion. Thank you, doctor.
Por el comentario muy
Thank you, doctor, for the remark. And there is a certain point, doctor, where
implementación de los planes, programas. ¿Cuáles suelen ser las principales
about the implementation of the different programs, about
trabajaron en
what
la
are the different boundaries based on what you work
aprendidas podemos
in the high-class commission, and what are the lessons learned as a country? And I know that this is not
tan arduo esta ruta porque creo que es fundamental
not
la
something that
evaluación.
not easy to
Entonces,
digest, but it's something important
punto, por
with the
favor.
assessment. So I don't know if you can, or you can add something. Sorry, doctor, I wasn't able to hear the first part of the question. I think it was something with the
De planes,
connection. Yeah, I was talking about the evaluation of the implementation of politics.
justo cuáles son
If you
las
could
barreras
share with us the boundaries or the difficulties that we have to get to an accurate assessment. And on the other hand, if you could also share the lessons learned based on all the institutions when you
países con la parte de
put
evaluación
together the report,
estas
and
dificultades,
also if you know what other countries
recetas de
have
cocina.
done to solve these these difficulties. And we know that this is not a step A plus C plus B, etc. But in Mexico's case, particularly, what can we done? What can we do to make this easier?
Una pregunta fácil. Nuestra
Yes, this is not an easy question, but from our perspective here, in the PHO, with different countries, we had a regional plan that expired 2 years ago. And when we did the job of the assessment of the different guidelines of this plan, which was a regional plan where we had priorities related to the countries, to improve the countries and some indicators, what we observed was that we had important progress on, for example, more countries creating more politics or more action plans. Also, we observe that more countries have more mental health programs. So, talking about mental health programs, we observe a huge progress because if you see there is more priorities put on the table for mental health, and on service spread from institutions, suicide, we didn't observe any progress, any important progress there. And I think now it's time, with all the visibility that the pandemic gave us related to mental health, we need to take advantage of this opportunity to step forward in these areas that we didn't improve as a region or as a country. So we need to prioritize with service expansions. So countries could have, for example, have like a certain idea of the different centers that they have to treat different mental health issues. If we could have like an idea of the basics that we have, maybe we could see a different scope for 3 or 4 years. And as you or related to the work that you're doing in Mexico, that you have like an idea of the general healthcare centers you have. If we could have the same information, we could see to the future to say we need to have these many more for these 2 or 3 years that are coming. So if we could have the capacity to say where we are and to check and to track these progresses. I have not a lot to say about this concrete progress because the vast majority of countries prioritize mental health during the last few years. But
y es el
I
trabajo
hope
que
that in
está
the next years, and it's the work that we are putting a lot of effort in the PHO
para poder
to have specific guidelines to show
eso
this
necesita
was the
mejorar.
progress, this is not being progressing, this needs improvement. And this is the strategic idea and concrete idea in mental health matter. It's an important priority for me regionally and for all the countries.
Gracias, doctor Renato. Y bueno, me gustaría
Thanks, doctor.
comentar esta pregunta
I
a la
would
doctora
like to mention this question to
desigualdades.
Doctora Evalinda. Doctor, how can we reduce the gender inequalities?
Incidir,
How can we, where can we start? What can we do next?
sé que
I know that
pero
it's a
bueno,
complex question, but please, can you tell us about
Hay que
it?
definir cuáles desigualdades de género.
First,
Las desigualdades en
we
educación,
need to define the gender inequalities. I think the gender ones,
nuestras unidades
or
de
to track them, we need to analyze not only for our mental health institutions, but health in general institutions. We need to define them,
perspectiva de género. Regularmente
understanding the gender perspective, because when we try to create this public politics, we try to
decir que
implement
hemos
more women than men. And it's, I guess, because women require more attention than men. It's not that
primero
we're trying to get more attention, it's because we need it. So we need to understand the risk factors and all the inequalities in the society
aumentando el consumo
that
de
are related to more depression in women or more consumption of alcohol and
nos va a permitir hacer
tobacco,
políticas públicas
and also related to the post-traumatic stress. Once we understand that, we will be able to create new politics.
dispositivos y el sistema de
And
salud.
after that, we will have to review the
Es un ejemplo
health system.
que
And we need to realize that the health system is not
hay que ser bastante
equipped to treat women. Let's be honest, because
primero el estigma es
we
mucho más,
need to
¿no?
improve the facilities for women that are
Los que sean,
addicted to any substance.
las mujeres son
Because, for example,
de atención y
in
análisis.
women are abandoned on those centers, and on men is it totally the contrary. They are supported for everybody. So the point of that is because they are bad mothers,
Si logran pedir atención,
and that's why they
atención especializados son muy
women have more difficulties to ask for help,
puedan
even
tener
inside the secretariats. So
cuando están en
even when we are taking care of their children, they are on a treatment, we have the tools to talk with them about these violence factors that they are living in, so we can help them with legal support, not psychological and medical help, but also we can talk to them about sexual matter that it's also very important. So it's something complex. It comes something complex when we try to reduce that gap of gender. So first we need to understand the risk factors that allow that
cambiar el sistema de salud y que sea
that gap,
acorde a eso y que sea
and
también
then we will have to change the health sector.
hablemos, o
And
sea, de
also,
los tipos de las
let's
mujeres.
talk about the different types of women that exist. These gaps will be different from the different type of skin, the economical access, if we are
Así que no creo que haya
transsexual women, etc. So it's a lot of complexity there. There is no specific question answer for this question, but those will be the different scopes of analysis to improve the gender sector. And that's why I told you before, hey, let's do something related to gender of scope of gender
las mismas opresiones
or
las que
anti-racism,
mujer
because the anti-racism
una mujer con un tono
or
de
the racism is different from the different communities or different women.
Creo que
For example, the transsexual women or the indigenous women. So those are the things that we need to mention, that we need to review to adequate the different services and in the different locations or communities.
Gracias, doctora. Y me gustaría un
Thank you very
comentario
much, doctor.
final para cerrar
I would like a
nuestros
final
panelistas.
comment for
Pues
each one of our speakers today related to
en
the
estas
challenges to
recomendaciones
keep moving on in these recommendations that were
de alto nivel.
issued by the committee or the high-class mission.
Doctor
So, for
Evalin,
example, you, Dr. Renato, Dr. Valinda, graduated Ana Cristina Mendoza, could you give us a closing remark facing the challenges from now on?
Y continuemos.
Okay, I will start with this. So I would like to say that we need to keep talking about mental health. Not only, let us not let this
Tener continuidad y avanzar con
be
esta
forgotten. Just a moment. No, we need to keep moving on mental health situations. We need to improve the population mindset because we need to let them know that everybody can do anything. Dr. Balinda, what do you have to say?
Reto tiene que ver con la
I think the big challenge is the activities, the political activities and the technical activities, because Mexico has a very important and great technical activities because the psychiatrics or doctors we have are very good
no solamente desde el señor secretario,
prepared, but
desde
this
la presidencia, el
this
propio presidente
improvement that was done,
nos ayudó a darle un tema,
it
a
helped
darle
us
esta empuje
to
tan fuerte y que
give this
32
bus,
mesas
this
estatales
important bus,
un tema
to have
principal para
32
salud
state
del
tables
país.
and make this not only
Es muy complejo porque tiene
an
mucho que ver con la
issue
sensibilidad de
for a
las
region but for a state. And
las
this is something that needs to be tracked based on the people that are taking decisions. I'm talking about economical situation that will be also complex. We need to review the processes that we're working with. For example, if we are working with a definition of mental health, this is so big and there are not enough resources to cover everything. So we need to see the ways to work between organizations
secretarías a nivel
to keep
eso sería.
improving in the
Gracias.
different states. Thank you
excelente.
very much.
Muy de acuerdo. Tenemos que,
That's
entre
good.
todas las
I
instituciones,
totally agree with you. Basically, among all the
poner en la mesa de los que designan presupuestos y de los que tienen que ver con, pues, que tengan la posibilidad de
budget,
estar apoyando las
these
políticas
sectors and the other important partners
de un
to
momento,
keep
no darle la solidez
making
e irlo
sense
consolidando.
and not let it
Excelente.
be forgotten.
Doctora,
Thank you very much.
Ana Cristina, un comentario con relación a
Ana Cristina, do you have
que
any comment about the challenges that your country is facing currently
estas recomendaciones.
and to keep the proposal and recommendations?
Sí, gracias. Primero, mencionar que
Yes.
es
First, I would like to mention that first,
educación
we need
universitaria
to
o en el nivel superior puedan ser de
base
manera
the college topic.
afortunadamente en Guatemala el tema de la salud
Sadly,
mental
Guatemala
se queda corto
mental health matter
en
is
los ámbitos
pretty short, it's pretty tight in
institucionales,
more
habría que
clinical
tocarlo.
topics or institutional topics.
En este sentido, entonces,
And
es fundamental
in this
que a los
sense,
profesionales de la salud mental como a los diferentes niveles
we need to focus on the
interdisciplinarios
different
se les pueda
professionals or
hablar el asunto
interdisciplinary sectors so we can talk each other
de
this
interés
mental
político,
health situation
que es
as a
la única manera en la que
politic
la
interest,
podría
because that's the only way
dentro de los ámbitos de la vida
that we could
tomando en cuenta que las condiciones
implement the mental health in the daily basis, because we need to take or to bear in mind the social politic matters, and these have a high impact in people's health. So it is something that
conversando
needs to motivate us to keep talking about it and to keep improving the mental health situation from this perspective, political perspective.
Bueno, ya
Thank you
estamos
so
en
much.
tiempo. La verdad,
We
mucho
are
a la
time.
doctora Evalinda,
I thank you very much.
Ana Cristina, que nos
You, Dr. Renato, Dr. Evalinda, graduated
muy
Mendoza,
valiosos,
who
que
will share with us
enriquecen,
this 30 minutes.
Muchos
Thank
temas
you very much.
discutiendo y obviamente para
about
seguir fortaleciendo el trabajo que
seminars,
estamos construyendo en
and this
México,
help us
en el
to
sector
keep
salud, en el
working on what we're doing in Mexico, on health sector and social security sector. I'm very glad to you to share these ideas, and I think the audience appreciates it.
cerramos el panel. Gracias.
So we will end this
Y
panel.
continuamos.
Thank you very much. Have an excellent day, and we will continue.
Gracias, doctor Renato.
Thank you very much, Norma.
Muchas gracias. Un abrazo
Thanks,
a todos.
Dr. Renato. Thank you very much. A huge hug for everybody. Thank you, everybody.
Okay.
¿Qué tal? Continuando con las actividades del día de hoy, es para mí un
Hello,
honor.
to continue with today's activity, I am really very glad with the next presentation, which is a roundtable to be moderated by Dr. Evalina Meron Velázquez. She was a technical coordinator on the Adjudication Federal Department. She is a psychiatrist and psychogeriatrist. She is responsible for coordinating the national strategy for the prevention of addictions, together for the peace director of the National Tobacco Control, CONADIC, and currently she's the general director of the National Commission for Addictions at CONASAMA. She has two master, one on medical science by the UNAM and another one on public administration by the University of the Valle de Mexico. So we welcome Dr. Evalinda Barron Velázquez, who will be moderating the table called Multisectorial Collaboration and Social Determinants in the Problems of Mental Health in Mexico. Dr. Go ahead, the microphone is yours. Thank you very much to the GIMS and to everybody for the space and to the OMS for the coordination of this Congress. The name of this roundtable is a collaboration multi-sectoral and the social determinants in the problems of mental health in Mexico. This is very interesting because it is a complex topic. I think that for all the public problems, this is very complex because the integration and the enforcement in the whole territory is not simple. So we have three big invitees with a lot of experience working a lot in this country in order to make projects on this regard. Our first speaker is Maestro Adrián López. He has a public, he studied at the Tecnológico de Monterrey. He's as a doctorate. He's a coordinator of social prevention of crimes and the prevention from the Ministry of State. He also worked for the Ministry of Trade. He was advisor of the under ministry. He has government projects and government management at the Mexican Republic. A big welcome, Dr. Noriega, and go ahead with your presentation. Hello, good morning, everybody. Okay, from the Ministry of the Interior, we thank for the invitation to participate in this Congress. I think that it is very important what Dr. Evalinda mentioned about our works in the participation of the community, of the people, and the importance of the mental health promotion as well as the prevention of addictions. For us, as the Minister of the Interior, it was quite a challenge to transform the vision that we had in the ministry in the prior years, I mean in the prior administration, so that the ministry be the entity promoting co-responsibility, promote participation of the community, mostly to take care of the problems they have, the public problems they have in the community, because that is trying to make them co-responsible, not only in the government actions, but to be more sensitive to the population needs and to be more sensitive to the population, to be integrated in all these processes, which are part of the decision making. And obviously to be integrated from the very beginning to the conclusion of any plan in any variant. In this case, what we have here and what we as the Ministry of the Interior learned is to transform what we had to transform. So at the Ministry of the State Interior, with this model of addictions prevention, we also participate in something very specific, which is I'm coordinating. This is the social prevention and the reconstruction of the society. So to talk about the reconstruction of the social tissue is to participate with the people and to generate community links, trust in the institutions, trust in other members of the community in order to take care of these issues that they identify in their space. So we have a very good point of view because through this strategy to prevent addictions, because it was promoted by them, and we are really very glad to make a contribution to this strategy, because we are trying to transform this point of view of no stigmatization and not to associate this drug abuse with violence and criminality, but to integrate them and to include the community as a protection shelter. That's what we started to do in this regard. Based on this context, the Ministry of the Interior started to participate in this strategy with EMPA by adding what we had and what we consolidated and what we fine-tuned during this administration, which allowed us to see the reconstruction of the social tissue when we created this concept in different components. They are not duplicated, but they are complementing one each other with other strategies such as EMPA. Here, we see all the components of economic development, education for the peace, education on the community, culture, as a main component in these entities. All this trying to be focused on the youth, to focus on the different genders and indigenous population. We try to integrate all these elements. For example, a social tissue development cannot be individual, just to solve violence or to solve conflicts, but it has to be integrated articulately with other elements that are supporting this social tissue reconstruction. With this planning, with the community care, we, in the reconstruction part in the Ministry of Interior, we try to find which were the programs that they have scheduled. How can they make a contribution integrally in order to have a process or to have a transformation of the community on this regard? For example, we had the health ministry through CONADIT and now CONASAMA with psychiatric care because they were allied since the very beginning. They also had these entities for the peace. We had INCUBE, Institute for the Youth. We had CONADE. We had entities that among their faculties, they had the promotion of health, promotion of mental health, of course, and prevention of drug abuse. So, can you help me with the presentation? The idea is that on this structure, this is what we understand as reconstruction of the social tissue. This is a very important part. And this is going to be before talking about the community, because this topic, what we are willing to do in the Ministry of the Interior is that together with the community and with the entities from the three levels of government, the academy, religious and international societies, we can promote these four elements. The first one is to build the social, political, economic, and education conditions that may lead to harmony. Number two, generate a linking process among people and institutions, because when we went to the communities, they did not trust of what was presented by the government. So this trust generating with the community job was something that we did together with the entities to encourage identities, because this is what we do with the social tissue. And these components, as I mentioned, are the ones that we are going to be centering in this presentation. This health and community care, since the Ministry of the Interior, we are trying to find a proposal so that this may integrate all these elements. First, care to vulnerable populations, youth, kids, but without forgetting other segments of the population, for example, Afro-descendants and indigenous. It is important to have them all in the map, because we cannot have a process or an action if we do not integrate this vision and these populations. What we are willing to have is to promote this protection and prevention, so that the community take care to promote, encourage, so that people with any of these problems may find in the community this care, because in the past they only found the stigmatization about consumption and all that. In this context, what we wanted to do is, okay, first of all, let's approach the population with all these strategies regarding health, to always be present in the practices in order to reach this vulnerable population, to know about this collective care. The most important part was promoting that people could participate and to take care, the communication and trust to take care of his needs. And the third one is to associate the population with the mental health and prevention of addiction services. We had to be innovative, and we, as the Ministry of the Interior, we wanted to promote all this. With this process of the Ministry of the Interior, we, the same as IMPACT, we created an articulated plan so that these efforts were not individual, trying to find the objectives, but that all the entities able to take care of this reconstruction make an agreement to make some collaborations to be more effective and to have a better impact. This was born in the 2021 in order to ensure an effective coordination and sustain in the 18 entities. These are some of the entities. We have special embassies, which are international organizations that always help us providing their external opinions about how they understand this peace building. But if you see all these participating entities in the Ministry of the Interior, which we are coordinating, but it is also our duty to find all the spaces so that these processes can be enforced. We are participating, for example, in the health part, CONADE, HUBE, clubs, safety, and DIF that at a certain time was with us, how they generated interesting plans for health promotion. These are some of the territories where specifically we had all the components. In each territory, we integrated the different entities and elements. It may be 1 or 5 components at the same time, but in these states and in these municipalities where we carried out these components for the community care. And we are very proud to say that in these spaces we generated interesting processes with interesting outcomes about how the community is being integrated and how they are becoming co-responsible parties, not leaving only the health institutions to be responsible for. We must have a space to promote prevention, and in these specific spaces, mostly on mental health and addictions, we had a very interesting examples. I'm going to show you some of them. For example, in San Felipe, Baja California, let me tell you how was it. The Ministry of Health, through CONASAMA Study for the Peace, invited us to work with the fishery sector regarding drug abuse among fishermen, mostly young fishermen. We went with all the institutions, we talked to the state, we talked to the municipality to see what can they provide us, what could be their contribution to this community care. First, we were talking just about the prevention of drug abuse, but that was only one action. We may have all the actions from CONASAMA, from the state, but we found three specific items that were associated to drug abuse and mental health. If we put them all together in a good party, we could have a better impact, not only to approach the addictions matters in the young population, but how to talk about this in the schools, how to enforce the actions, how to recover the public space, because they said in the public spaces where we are identifying dog abuse. So this is also a cross-section problem because we must also improve the drug abuse at open spaces. And then we said, okay, we already have a group of fishermen, but instead of just solving the problem with the fishermen, but we must find a way how to sensibilize the other people. It was not an individual action, it was an institutional effort with different entities to transform this problem. This in San Cristobal de las Casas, we were really very glad because this component of community health was very strong regarding the institution's presence because it was a problem resulting from the young people in this municipality. It was a huge effort made by the public sector and the state to bring information. The people and the young people didn't know the details about the drug abuse problem. There was a lot of stigmatization. The idea was to transform the whole idea. We had a very good approach trying to transform this point of view about how to take care of the substances abuse. I'm going to close with this one. This is Cuautla in Morelos. Here we are willing to show that the municipality, after training and after the training of other entities, they had an initiative to bring all these processes directly to the young people, to the school. They made the transformation in the peace culture. And with this transformation, they approached or they took care of different entities from many different entities. Here we can see the willingness of the people and the government to make these actions a reality. These are some examples of what we did in the municipalities, and this is the end of my presentation because the conclusion of this effort is to understand the prevention, substances abuse, mental health, but to To understand it, the first step is to be trained about how to do this reconstruction. Since the very beginning, the Ministry of Health and through Panasama work with us together in order to understand the point of view of the government on this regard. Something that was different, that was not the same as we had in the past. This is a new effort because the message about how to understand these concepts must be made by the experts managing these issues so that we go to the community when we participate, we can provide a message from the government, MCA, CONASAMA, and many other entities integrated in these actions to go to the territories in a very good manner. This is the end of my experience, and we can have some more comments. Thank you very much, Adrián Noriega. It is important to say that the coordination, when we talk about these 35 million people and 2,000 actions, it's quite different when we see all this integration and all this education and understanding of concepts that are not so simple, but that the community is accepting, and it is becoming in something very beneficial. Now we have Licenciada Elizabeth Vázquez Ramos. She has a title on linguistics. She's a specialist in writing in Argentina. From 2001, she works and participates in popular education and to form communities, and participated in different education plans at rural level, mainly with women and young people. Right now, I think this is one of the components that we were mostly afraid of, because this is integration of a whole government policy. Hello, good day, good afternoon to everybody. First of all, I would like to thank the invitation to participate in this Congress. I'm going to share my screen in order to start sharing the main ideas that I talk about for this Congress. First of all, Dr. Evalina introduced me. I am Elizabeth Vázquez. I work for the office of Jesus Ramirez, the communicator of the Republic government presidency since the very beginning of this strategy. Work as one of the heads of MPAC together with CONASAMA before CONADIC. And precisely one of the things that they do with MCAT, it's the component of peace clubs that I will briefly explain. Another of the actions made with MCAT was different media campaigns in Mexico, in the Ministry of Public Education, etc. The peace clubs, as Evalina mentioned, in the beginning was something that we were mostly afraid of, and I can still say that I am still afraid of. Why are we afraid of it? Why do we have this so much expectation? Well, because it was mentioned as one of the community components of the national strategy for the addictions preventions. The intention was that all the specific elements were associated to the health professionals, and they insisted in having a part of the indicators and specific criteria on the hands of the territories but it was over there where we articulated all the other entities of the federal government with a presence in the territory. In the peace clubs, one of the things that we do is go to the municipalities, go to the neighborhoods, call mainly groups of young people to form a peace group, which is mainly a group that operates like a committee. They are not necessarily health professionals. In fact, they are mostly not. They are students with a different formation. Sometimes we have adults, elderly, group of neighbors. The profile changes according to the community. These peers get trained on basic topics covered by impact. It's mental health and prevention of addictions. On the other side, we have culture and reconstruction of the social tissue and also the community actions. What is the intention? Well, it is that these people can perform actions to promote mental health or to contribute to the peace in the community. As the purpose, well, their actions must strengthen their community, and some of their actions must mitigate risk factors in the community, always putting in the front prevention of addictions.
Insisto, principalmente esto
And I insist, this is mainly done with the young people, but not only young people. In some other places, the adults are willing to participate. Sorry, I think a microphone is open. Well, I was saying the elderly people also, it's also willing to participate. What I want to share with you is a little bit about the experience from the peace clubs. We started to form these groups with the people or with the volunteers that were trained as promoters. We've seen, and we are trying to do this more robust, that the protecting factors and risk factors more than a content to be conveyed by the promoters, well, that we could use that for many other things. I tried to put it into planes, individual and collective. The protective factors and risk factors at the individual level allow us that promoters, and we have to say this, that we ourselves, those participating in these training processes and workshops, well, this allows us to identify things in ourselves, situations in ourselves, to reflect and to make the decision-making process accordingly. And at the group level, well, the idea of this addictions prevention should be a joint action. And this has been used like a tool to promote actions to solve problems identified in the prior phase and to move from planning to action, trying to transform some realities that we are willing to change. I'm going to talk a little bit in general, but at the same time, I want to use the example of the most recent experience in San Cristobal de las Casas that Gabriel already mentioned about the work that they did and how the peace clubs were participating. Is appropriation process of these concepts and to use them as a tool happen in workshops, in participating sessions. As you can imagine, it does not happen in only one time. We need several sessions in order to do it. But I think that we can make a plan as follows. We started with a generating topic, like saying, okay, let's talk about biopsychology for the young people. We do not mention it like that, but right now I'm going to mention it with those words. We put a generator in the center, then we started talking about the mental health, the community health, to prevent the substances, drug abuse, addictions. Then we provided some information, we made some presentations, and then we move to the reflection cycle, because this is what is also known as the culture cycle. When people already have some information, but now the participants know, believe, have seen, think, realize. It's building knowledge. And basically, this is supported by a dialogue. Everybody being there, use the reflection, the strategies, but the main purpose is reflection. As we say in Mexico, to realize it, to understand it, to understand what that topic has to do with myself, with my family, with my friends, and what can I do on that regard. The next time is the knowledge appropriation, which is to take okay, we already know that we, the young people in San Cristóbal de las Casas, which are the people appearing in these photographs, we identify the factors, we identify where can we have an effect in a group of 20 or 25 young people. Of course, we cannot strengthen all the factors or to make them all, because we also identify these problems, because that is not in our hands. But maybe we can have an effect into protective and in one risk factor. In this case, this group of people were trained for workshops on artistic and cultural activities. The question here was, how can the artistic and cultural activities represent a protection for the community in San Cristobal, and how you workshop heads can be the change? All this is a result from the knowledge appropriation and also the transformation of practices, because it is very hardly for you when you understand how the protections work and when you do this internal observation. Your attitude will be, okay, let's keep things going on. Most of the times we are willing to do something after doing the reflection, after learning, or maybe there are things that we do not want to do anymore. Here, just to mention very briefly, this group of young people in San Cristobal is formed by different university students. We have indigenous people, some other people living from in the municipality. They are kids that they are working in these artistic workshops, which is the last picture that you can see. And here you can see how these youngsters assume like a figure, generating a safe, nice, and ludic space for young people in their municipality so that they think that they find that they are the head of a group that belong to their community. This is what I mean by changing practices, as we can see in the last picture. And the last way to represent this, I am sorry, I'm taking more time, but I want to share so many things. Well, we have this table where I identify three moments. The momentum to recognize practices, knowledges, the time to reflect the senses, why we do things, the consequences of the things we do, and transformation time. Our practices, how do we use alternate processes, and how can we learn more? Then, for example, a very common case, at least in Mexico or in the center of Mexico, is that on Saturday or Sundays we have tournaments or matches of football in common fields. And at the end of the match, we have a group of men going to the store and buy beer to drink it in the street, sitting on the street. I don't know if this is right or wrong. That's not my concern. But we have to analyze the group because this is a practice that they really do at the end of the football match when they are sitting in the street. And then we know that. And now, why do we do that? To relax, to do something, to spare some time, and then to think about the consequences. So maybe some of them just go and then go back home and that's it. But some others just start drinking and continue drinking. And maybe my family will have to come here and take me home, or maybe I am spending time that is needed at my home, or maybe there are no negative consequences, and that is also something to be reflecting on and to transform. If I want to transform that practice, but maybe I don't want to, what do I do with other people? Or what do I do in another momentum or in a different way? Here in the picture that you see, it's an example of a very simple exercise, a very basic exercise, but it is also very important that we do about the protecting factors and risk factors. Because people usually do not only write what they think that is a protecting or a risk factor for their community, but this is a simple way to organize and to find the most important category that the community feels as the most important factor for them. Which are the big conclusions that I know that you already have identified them very clearly, but these are collective conclusions of the groups of young people, of elderlies, that I repeat are not necessarily professionally trained on health, and that in some cases do not have the health services or mental health services, or maybe they have them, but they do not know that they have access to. The first collective conclusion that we do after all these participating sessions, among the factors, there is a correlation and not a causality. Always to insist that the exposure to certain factors does not mean that my life is going to be wonderful, and that some risk factors do not mean that my life is terrible and that there is nothing to do. It is not black and white. because afterwards we will not be able to use all that for my future planning. And then maybe a protection for one person is not a protection for another person. That is why this is very important in the communities and in the neighbors, because even if they are same age people or in same communities in San Luis Potosí or in San Cristobal de las Casas, well, the outcome is going to be different. Unfortunately, this is our reality in Mexico. For example, a protection factor for a girl is to be at home with her parents, but maybe in another context, for another girl, to be home with the family is a risk factor. The third one is the promotion and the healthcare is not exclusively for the health sector. Everybody can do a contribution from wherever they are. Obviously, we are not at the diminishing the work of the health staff, but we are calling, even if I am a teenager or a mother or a retired elderly, or if I am a grown up adult, if I am driving a taxi, everybody from anywhere, they can make a contribution to the individual and collective mental health. This is something that it's not clear to everybody in Mexico because they say, if I am sick, I go to see the doctor. And the self-care is not sufficiently conveyed among us. And the last one is the biosocial determinants are a tool to reflect and to analyze. It is very important. I mentioned that this can be adapted to the context, but it will also allow us to do the planning based on a protective factor that we decided to adopt. Then, through the strategic activities, we can strengthen this protective factor with this 15 or 20 people group. That is our planning. And the last one is that people must know their reality and that they must act in order to transform, because all the colleagues forming the communities must not wait until the federal or the state government to go to give us everything. That's okay, that's their job. But also the groups must remember that the government come and goes, but the groups remain in the communities. So this way of work in the communities tell us that collective problems are to be collectively resolved. Here you have my email address and my telephone number. Thank you very much for your attention. Thank you very much. It is very important, this interaction in the community. When we try to separate these services and when everything is excellent in the health system, what we do
we have
when we have some tools, it's not only working in our doctor office because it
with
was
someone,
very hard to
we have
the integration with
difficulties
the communication
of this
because this
academic.
is far away from the population, because we were seeing these illnesses, not the health. This is just a concept. This is the concept that we have as the health department. So all the work that we did with the communities, I think that we can talk about how we can work with all the ministry, and that provided us the tools in order to make the integration. because public health was something that we were working on. Here we have some questions. And now let's start with our next speaker.
Ella cuenta con licenciatura en Administración Pública por la Universidad Autónoma Metropolitana, cuenta con amplia experiencia en el de programas deportivos,
by the UNAM. Also, he has worked with different physical cultural implementation. He has been working as a basketball teacher for UNAM institution. He worked
para
with the
coordinar
CONADE to coordinate the
mundiales universitarios. Realizó actividades de capacitación
of the international games.
y se
He
desempeñó como
developed
director
a program for children in the DIF. He collaborated with as an administrative in the
en los programas
INE, and currently he's working with state and national programs for physical programs in CONADE.
teórico
She
específico de
she has always working
o ayuda a disminuir los factores de riesgo o modifica las políticas públicas que llevan a las
or
personas a los consumos de
modifies the
sustancias
public politics that
Nuestra colaboración con CONADE
to mental health issues, and our collaboration with CONADE has been a priority to build this strategy. Welcome, Jan.
Gracias. Si me pueden apoyar con la
Thank you very
presentación.
much. If
En
you
primer
can
lugar,
help me with the presentation. And first of all, I would like to thank you for this invitation. And also, I would send you greetings.
La congratulación que me hizo extensiva la maestra Diana Martínez Campuzano, quien
Thank you
cabe decir que
about
si no hubiera
the introduction
iniciativa de ella,
for this graduated, and without her,
en el ámbito de la salud,
because of
quizá
her professional profile in health matter, we wouldn't meet each other and we wouldn't be working here today in this Congress. So to define a framework as Adriel did, I will define that from the WHO organization. We will have a framework developed on physical activity and non-transmittable illnesses at the global level.
mejora las
Those
habilidades
activities
de
reduce the mental health issues or depressions, and they improve the learning and health on young people, or also the welfare. So if you can move on to the next slide, thank you very much. We will start with this
impulsados del gobierno de la República.
collaboration of multisectoral and different social issues on mental health in Mexico.
Pues nos insertamos nosotros en esta sinergia
We
de
started in this
del gobierno federal que se sumaron a
project with different states of the
como
government.
bueno, definió el
So
deporte
we defined it, the social activities as all communities activities. If you can move on to the supplement, please. What is important to us? Well, what do we do? Well, basically, for example, on 2019, we did a training process for physical or sports programs, and we faced different issues with people that they had like a type of certification to do physical training, and they didn't know what CONADE was. They knew the logo of the institution, but they didn't know what it was. So we tried to make everybody know what we are, and basically we are a dependency of the government that implements the politics of sports and physical activities.
Bajo el esquema de inclusión,
and we work under the slogan of non-discrimination, and also we give access to everybody as the Constitution states for physical activities. The next slide, please. We have as a purpose the physical activation of the population, Mexican population, from 6 years to any age. But the
de deporte, que es donde se
physical
coordina
activities that the CONADE does are specifically for sports or all related sports
en el proceso
and high endurance sports. We start with the basic physical activity, and then we guide people to different sports. And here in CONADE, we, when the law of physical culture and sports, we developed
desarrolla los planes y programas de este
different
año.
programs for this scope. Next slide, please.
Entonces, cultura
As
física.
I mentioned you, physical culture is where I am working. It has 3 action lines, which is physical activity and recreation and national events. Next one, please.
Esta
Okay.
básicamente está
The
enfocada
first
hacia
one
la
is physical activity and recreation, and it is focused on people. The inclusion of all
para la ocupación del tiempo
social
libre,
sectors to design alternatives to
las actividades
improve
predeportivas.
those free times that everybody has related to sports. And the idea of this is to face the inactivity records that based on different figures provided by the physical practice module done by the INEGI from 2015. It shows some figures and statistics about the surveys that are applied to measure these physical activities in the society. And what happens here is that it's very short because the decisions are done upon 18 years old. So I will share with you some data from the WHO. So basically, this is focused on reducing the obesity rates in population and diseases. The next one, please. Here we have the bird centers on municipalities or schools. Basically, here we distribute different sports centers to implement on children's or adults the different sports, or to have a bound with the DIF for elder people. And for sure, young people start the sports when they start their school. So basically, we try to do a systematic way to implement this physical activity. The next one, please. We have national sport events. Basically, this is done by the program of physical culture and sports. And here we have different ages from childhood to younghood in a systematic way to protect the sportive values and to introduce them into people to live into high performance sports. On 2019, when we started this bound with this strategy, based on this strategy that the chief of physical activity proposed, we integrated each other, or we merged each other with different institutions to create different recreation programs, highlighting this as a protection factor to create physical activities to everybody, and to improve health related to physical activities. And this physical culture constitutes an important part for physical and health welfare from different parts of the society. Next slide, please.
Visibilización de la estrategia surge para nosotros a partir de 2021, donde
this strategy
crear las
2021, where we wanted to create or develop the different actions to implement them from 2019 to motivate
voluntaria de los órganos
different communities
en el país, que son
a different action in
cultura física y deporte, sus diferentes denominaciones, porque a partir de la propia legislación de cada gobierno, pues
of every state, different governments have different denominations. Basically, there are congresses, there are councillors, but we were able to have the opportunity to have a participation on this
un marco
institute, which is
general
create a general framework about what the actions are considered important for the addictions fight.
Estoy mostrando esto como muy general. De veras,
I am sharing this as a general way because the creation of a project as this has a lot of aspects, but it is important for me to point out the essential ones. Because, for example, one of the actions was done to try to incentivize the different sectors or public
en la CONADE piensen en la CONADE como
services.
poder dar atención
We need to see this as a community and to bring help to these dependencies, or it requires like an army of people. So what we did was to define a strategy from our scope to train people from different dependencies that were used to practice any sport, so they could have like a basic and knowledge to create actions in the inside of their own environment to motivate and implement the physical activity normally. The next one, please. Then
con esta
we
colaboración, de
also
esta coparticipación con los estados,
with this collaboration with different states,
que la CONADE hace una inversión
we achieve
presupuesto,
an investment
poder
from
realizar
CONADE, from its budget, to develop this movement or these activities at the national level. But however, there is a different participation from at the state level to create
dar acceso o brindar la
actions
posibilidad
together. What we did was to
de
give the
difusión,
possibility to the different institutions
pues con el
to
apoyo del sector
implement
se logró como quedar también
programs for socialization and information
identidad que ya a partir del año
to
2022,
create this
el
identity
ya cuando hacemos todo
that is
lo
consolidated on 2023, and this will be shared when date comes on this year to let everybody know the identity of the different events, because for us it's very important what we are in this huge movement that has as a priority to improve the protective factors for
la siguiente, por favor.
Substance consumption. Please, the next one.
Entonces, a través de esta sinergia, bueno, pues
So,
se han generado a través de los
based on this
capas
movement, we have created different layers or different models installation
comprenden nacionales con área
based
aproximadamente
on this
51
conference system. And this conference system has around 85 modules for sportive activities. And in this year, we have figures,
arriba de 30,000
higher figures or higher than 30,000 sportsmen. But we will report this until we have the final figures. This is just an estimated based on what CONADE estimates.
Sin embargo, si nos vamos
based
hacia
on the annual allocation. But if we go to the basic sports, I can tell you that from the process of communities or municipalities or regional or national, as it is established on the physical culture and sports, we are talking about figures of 5 million people. So these new areas or spaces that have been created, which obviously have the work of the organizations, based on this, we can say that the competencies are implying this with personal
que la gente o los que
personal train
o los que participan
the ones that participate in this sportive matter know that there are some instances or some places where they can go and get any different type of attention or help. For example, family help. The next one, please.
Esto ya es más bien aspiracional. Tuvimos una posibilidad
something that we hope to achieve, and we had an opportunity to establish this last year.
Con la licenciada Elizabeth.
We were able to work with Clubs por la Paz, which translates literally as Clubs for Peace, and we did a test program. And Clubs for Peace helped us, gave us all the planning, let us know every aspect in the community or different municipalities from Guadalajara
puntos rojos, puntos de
consider
atención,
important or
pues se les
dangerous places
a esta
for
información,
attention. So we did this introduction today.
encuadra
And
línea perfectamente a lo que
this
se pretende.
aligns to what is meant to have with different steps where there's
Una atención
established
prioritaria
different
y que a través de una capacitación, bueno, se
people that
puede
need help, and from a training they can be implemented, they can have the information to prevent the substance consumption,
desde luego la participación
of
comunitaria,
the peace scope in the communities,
de trabajo
and also
para
the
poder
design of a framework or
conducir o
a
guiar
plan of
este tipo
work to implement this promotion,
acompañamiento.
and also the implementation and
Es bueno
tracking in community actions, as I mentioned, the health sector and
en términos
peace sector.
generales y desde luego, bueno,
In general terms, and then
porque yo
to end my participation, because as if you can appreciate, I decided to
me ayudó a superar
have a lot of impact in the sport because sports helped me to overcome a psychological issue. So I will make this closing generally about why is important to start practicing a sport as a child. Well, basically based on the figures that the WHO published in 2010 for different communities, considering the importance of sports from childhood.
Para la infancia,
There were some recommendations or advices from physical activity from 6 years. So if you're wondering why is this age, is because from to get these figures, we need some figures to determine
generar campeonismo a etapa temprana, porque
that
entonces
it's not good to generate
en lugar de que los hagamos productivos,
competitivity people because they cannot be professional at competitive
y no queremos eso, queremos que se adhieran. Entonces,
this causes people to let sports, and this is not good for us. So I try to share a good mindset, and I told my students to practice some principles. The principle A is to give yourself the opportunity to practice a physical activity so you can experience yourself the benefits. The B will be the autonomy, the self-knowledge, the self-control, which is the management of emotions. And another important aspect in general terms is the conscious, the compromise, and the consistency. To learn, build, create.
Eso fue muy
Thank you very
importante.
much. Thank you very much, Aide. That was very important for us to understand that not every sport was a protective factor, because some sports could be dangerous factors if children abandon it or not. But this exercise was done with CONADE. We have some specific questions related to culture, that was built with different institutions, governmental institutions, during this campaign, for this strategic in the classrooms or training processes to assist different social issues as discrimination on schools or bullying. And there is a question that goes as this: how are the electronic platforms are being developed like this to measure between
colectivas que se hacen desde la prevención
relation, because there are some mentions that are done by the ecosamas, but to have a report to assess multisectorally implied a higher work with 5 guidelines to determine the risk factors, the public politics,
salud mental,
the
la quinta que tiene que ver con la ampliación de los servicios, que es más específica para el
implementation of the different
Y todo
services and
era
social services.
ir viendo qué era lo que hacía cada uno de los sectores para poder decir, bueno, tú como CONADE
Also,
esto
we
es
needed to see the different needs of the sectors because
cómo
this
Secretaría
reduces the factors. As
Cultura, esto
Minister of Culture,
factor
this
protector, y
reduces the risk factors,
colaborando con la estrategia
and
y no solamente se integra,
this
actividades específicas.
generates different activities.
Panelista con el maestro Adrián Noriega.
I will move on to Adriana Ortega.
¿Cuál fue la dificultad para integrar el término de salud?
What is the difficulty to implement the
Que no
reconstruction
son términos
of
que
social
manejen
tissue directly? Because these are not terms that we handle currently in schools, but when we start working with them,
Tiene todo un reto para
it has like a
las
big
personas.
challenge behind to people have it.
Efectivamente, creo que el principal reto, y lo mencionaba un poquito en la presentación, ha
The
sido
big challenge, as you mentioned, was
la
to
comunidad,
change the paradox
estas,
of how community understands these
a nosotros,
topics.
cuando hacemos esta estrategia
When we build this
el primer
issue reconstruction in social
es
matters,
un diálogo
the first scope that
para
we
buscar puentes
tackle is
de primera
to look
Entonces, en un
for a
principio, el gran reto
sector
es, pues yo lo que
to
decía, ¿no? La
help
gente
them. So the
un poco de
first
la presencia de
challenge
institutos
about this is
en
that
territorio
people
de las mismas
don't
comunidades.
trust
Antes
these institutions among their own communities because
las dependencias a
before
solicitar algún tipo de apoyo,
people needed
por
to
ejemplo,
go
salud,
to the different institutions to approve the health cases. They needed to get closer to the clinics.
y al
But
momento de
now we're
como
trying to change this paradox.
estos servicios,
And
ofrecer
when we are
el primer reto fue
getting closer to those communities instead of them getting closer to the clinics, we needed us as
comunidad o la experiencia que nos tocó a
we
nosotros,
needed to break the barrier and reach out to them because when they reach out to us,
reclamo, en el
they
enojo de
let a lot of
muchas
things
veces justificado,
alone. So we needed to reach out to them so they could
con la
keep
comunidad,
continuing with their own activities.
integrar a estos procesos. Empieza a formar parte de en la toma de decisiones, como yo decía, y ahí es cuando nosotros,
When
junto
you
con las
start
dependencias,
taking your own decisions with the hand of the different dependencies, for example, with mental health,
el gran reto, insisto, es ese, pero también
the
nosotros,
big challenge is that, but also us as
ese mensaje,
public servitors, we need to communicate that message or not give another idea about how we understand mental health, because as a community, as I told you, as a state or as a community, the reality of the problems in regions,
regularmente,
we don't have a clear a clear perspective because we think that this is done based on statistics of official data that can give us general scope. But when you are doing a field work, you change that mindset, that message, and you start to understand and to be sensible about that you need to share the mental health as systems to everybody to change that mindset about mental health. And also on rural communities, this is important for them because they think or they have the idea of receiving help from another people, not us. But we need to make people sensitive and make us ourselves sensitive to share that message,
generar las
to
condiciones
spread,
para que la gente también se vea
to share the message with people so people can feel warmth and
conceptos y de
can
esta forma
feel that they are being taken care of. And also to one of those bridges that we need to break in this tissue creation is about it's the communication between institutions. For example, with CONADE, clubs for peace, etc., so they can have these
en estas materias,
personal
pueden
spaces.
que
So you, the specialist, could bring a message to a specific community that is conscious about the situation, so you can work together with the development of these necessities. This is a big challenge,
con la EMPA,
but I think that the space that we have match our things with you, with the Coneda, is where we can break those boundaries. Thank you very much. Elizabeth,
En las políticas
what is the challenge
hace un gran trabajo
of
de poder aterrizar
different public institutions about mental health with
hicieron en el chat y es
and I
cómo
will complement with different questions
si hay estímulos y cuántos
about, for example, Clubs for Peace. How can Club for Peace work together with these other institutions?
Hola, sí, ya por ahí algunas preguntas también las intenté
Yes,
responder
I have tried to answer some questions on the chat.
Pero creo que vale la pena platicarlo un poquito. Lo que hacemos para la convocatoria de las personas
What we do for these people that can participate on Clubs for Peace, they come to us when they recognize something that it's on the country. It's not just because it's the more logical thing, but it's because based on that, the community can
la
give us
convocatoria
feedback. So basically,
la naturaleza
the enrollment changes based on the nature of the coordination. It can have a government focus or on-government focus. For example, type of neighborhoods, parents, etc. So what we do is to invite people as a community work, and as you could hear from Dr. Evalinda, we do not have a budget as allocated to the addictions reduction. So that's why these institutes have been founded on the little budget that we have. So this enrollment could be just as a volunteer enrollment, or maybe we could have people that are doing it, social practices, or people that are interns. So they tell us, hey, we cannot still working with you because we have a lot of work, but there are a lot of teenagers or young people that want to participate in this. So basically, the approach depends on that relation that we're trying to have or to reach out to them, and the enrollment depends on that coordination. The people would like to be trained, which give us a lot of joy that people could train themselves in this type of institutions. I send back the enrollment so we can reorganize again, because maybe someone in one state says, I don't have these accesses to these programs. So I send back the enrollment because we're trying to spread these programs the most possible, because we don't have enough budget. But if you raise your hand and you say, hey, in this state of Mexico, we want to have a program like this, we can start working with this. So in 2024, we could have like a work agenda with you. Regarding the number of Groups for Peace, we don't have the information updated. I would like to have it to share it for you before the year ends, but we don't have it, and I answered that question personally in the chat. And related to the question that Dr. Evalinda mentioned, I think it's something like Adriel mentioned. I think one of the biggest challenge of politics, or one of the things that we cannot stop doing, and I know that you, as people that uh, make decisions or create a public politics, you don't forget about it, but we need to have it present and always bear in mind that maybe there are people that don't have a lot of experience on that field, is that public politics need to be fit, need to be constantly improved, so the population feels an improvement. And the community also, but the population. And when I say population, I'm trying to say that the different sectors that are allocated for this. And I don't like this because I think public politics need to be built based on what people say. But in some cases, these public politics were done based on these efforts of build the public politics together with the communities, but there are others that are well built but not well installed in the community. And another thing that I noticed on this question is that the public politics needed to be installed.
Licenciatura que me dediqué un buen rato al tema de
And I've noticed this since I started my education of indigenous tongues
para
or indigenous languages, and the public politics doesn't have a mechanism to have access to them. And those concepts, I like a lot those concepts because on lecture, we will talk about the disposition that you have in terms of having a library at the next corner of your house. That doesn't mean that you have access to that, because for you to have access to that, to being able to read, there need to be a mechanism so I can have that accessibility to that library. Maybe through people that introduce me to that library, or maybe through different cultural activities that are done in the library. I think that's a point that is needed in this public politics, not just to have them available for everybody, but to give them access. And again, from the community,
Finalmente anoté aquí que las políticas públicas no se
I
olviden de lo
noted that public politics needed to consider the public part, not don't forget about it. Because let's remember about the San Cristobal de las Casas the last week, because the Youth Mexican Institute has done an excellent work on this quarter of the year that hasn't been done on the last quarters. But even when the work has been done, for young people, this is a new. These are some news that this institute exists. For this is something new, that there's a law for youth. For them, it's new to know that they can take decisions for public decisions.
Entonces, bueno, a eso me refiero, no
So
estoy
that's
poniendo
what I'm trying
el
to
buen
say.
ejemplo de cómo ellos están intentando acercarse a lo público a partir de lo ya
Trying
instalado.
to say or to tell them to reach out to the public sector from the government institution. Thank you very much. It's very complex, and it's a process that we have been implementing because Together for Peace, we also implemented lecture groups on universities to let them know that this is for everybody. Other experiences that we have shared as Dinan are that this has been enough because people weren't coming to those attention centers. So
Secretaría de Seguridad, las
we also
cuales
work with
tienen
security.
esta lógica, son aquellos dispositivos que nos permiten ir ampliando el trabajo que tenemos con las comunidades para hacer justamente políticas pertinentes. Elvia, ¿cuáles son los beneficios del deporte en la salud mental que se han visto con la implementación de la
What are the benefits that we have seen with the impact implementation and what has been experimented? Well, okay. The main benefit that I can see is that since we have this strategy, we had access or we were able to provide the elements or tools to those guiding this sports training by sensibilizing about the basic knowledge on this prevention of addictions. And this was made through the training provided by the health specialists, because they trained on the 2019 about 1,600 voluntary staff acting as sport instructors, where they were given the opportunity to improve their daily activity in order to provide a quality care to the athletes. And then this was expanded with a more specific approach early this year, where thanks to the willing of the states, we had access to the ENIMS platform in order to have access to the knowledge, or to the PAHO proposal for the community training. I think this is a platform that can be used as it was used with these anti-dopage communities, so that the parents, sport people, trainers, directors get the training associated to this drug abuse. The problems here is that we have to overcome this resistance, because many trainers think that they know everything, that they do not know they do not need to learn more, but by training and by getting more knowledge, their mindset can be changed, because once they get the knowledge, they can get this transformation factor, generating important changes in the daily activities of those developing these programs. Thank you very much. We are on time, so I am going to ask you a final comment. What is the difficulty of the multisectoral integration in these efforts made in the territory for the reconstruction of the social tissue? How can we measure this? And a final comment. Thank you, Doctor. Yes, one of the biggest challenges that we had in this coordination from the different initiatives from the government at the 3 levels of government, well, is trying not to duplicate some efforts. If you see the example, show us how can we contribute, how can we coordinate initiatives in favor of the population. But regardless those problems, sometimes we have some other problems about the priorities from the state of municipal governments, because, for example, the government times, the reconstruction of the social tissue, mental health, and sometimes these are not important from some actors. This is an effort to make a joint contribution. This is not the priority in this conference, but it has been very important at different times of this administration period, because we want to put on the table the initiatives of any entity to complement the government actions. I think this is my conclusion about the cooperation of all the entities working on the community care and healthcare. And I insist, in the community, it's very hard to break the barriers. That was the main problem, but also with the local social actors to transform the message about how to see these initiatives. It was really a challenge, but we found not only in the examples mentioned by myself and the 2 other speakers, but there are many examples about how to cooperate at local level, but always considering the community as the center of the public policy, because at the end, whatever we do is to the benefit of the population. And these challenges will always exist. I think that the communication at government level will always be essential, and it has been flowing really fine, not only from EMPA, but also from the reconstruction of the social tissue. I think that all entities was really committed with the initiative. And how to assess it? Well, from the reconstruction of the social tissue, we have some mechanisms for the assessment. For example, for the articulation, it is very important to say, okay, Ministry of Health, you are going to do this activity, and I provided a speech to some people, and we have these peace groups, but this capability, how can they make the transformation? This is also at local level. That's why there are some municipalities with a very well focused activities, because we do not have the human resources or the other resources to take care of all the communities, because that is another challenge. But according to the exercises that we have done in the communities, has allowed us to identify that if the implementation of these different complementary activities take care of a need of the community, we will be generating the recovery of the social tissue. This is part of the actions of the ministry. This on the long term means that transforming the community, it must help it to reduce the violence and delinquency or criminality indexes. This is multifactorial. This is not only one topic. I don't know if we can say that crimes are made by drug abuse people. I think that we must understand the criminality, but not only with the outcome from drug abuse, but also to see what is generating this criminality. Yes, you go to the community and they say, okay, we had this crime because the person consumed such drug. And this is stigmatizing with the local people and with the community, because we have to say that this is also structure, and we have to move to the recovery of the social tissue, and a part of it is community and social health. So my reflection today is always, even in the exercises, training people to talk about reconstruction of the society is talking about something integral. And it should be not only in this administration, but in the forthcoming administrations. Thank you, Doctor. Eli, in the numbers, I think that the numbers are impressive. What was your best experience regarding the groups for the peace, and your final comment, please? Well, first of all, to say that I tried to put my contact data. I don't know if somebody of the panelists or the organizers can put it in the general chat. I think that one of the experiences that moved me a lot was working in Catepec, mostly in the pandemic years, where we had a lot of uncertainty and we had no vaccines. To me, it was really very bad going to one of the more stigmatized areas of the country, and everybody here know why, because we are Mexicans. Let me tell you that Ecatepec is a municipality in the state of Mexico with high levels of violence, criminality, and in the last years, unfortunately, with a lot of woman killing. So in all these workshops that I was talking about, it was very complicated that the community identify protective factors in the community or elements that were acting in the community too. And I may say that they were really ashamed to say where did they live, because these neighborhoods were the scenario of very bad crimes with a lot of coverage in the center of the country. I am not going to mention these crimes that happened in the corner of the place they live. To me, it was really very difficult to reach some groups, because when we see whatever is happening in these neighborhoods of Ecatepec, we still have some places where the social tissue is connected, where it hasn't been broken, where they have this community link, that they act as a community, and to see those little hope notes, and to say, okay, all this is terrible, but we have these little points, and maybe that could be the starting point. So I think that it's so difficult to go and talk about the mental health in this community, because internally you think, okay, let's see if we can do something here. But when you go there, you see that nice things can be done. Well, okay, after many sessions with these neighborhoods, one of the things that they were thinking in strengthening these factors was to get these public spaces with sports. So a voluntary teacher brought the boys and girls, and we made some activities in a very bad condition park. It was really a park that if you go over there and you do not feel like getting in, all the way around, you avoid going in that part. But even when the park was all destructed, it was something that the community could use. There was a voluntary teacher that could help some karate pupils to participate, and all the families in this demonstration of karate. And I know that you understand that this is encouraging and means hope for the people. So when you see this as a public servant, and when you do it together with the community, well, then you know that we can have some things to get better results. Thank you very much for the invitation. Thank you very much for your participation. Elvia, which are the challenges for CONADES so that sports can become a protective factor? Okay, thank you very much, Doctor. Yes, of course. The main challenge is to continue working, to sensibilize, and to make aware all the involved actors in sports, so that they get the ownership of this type of tools in order to reduce these problems of everything resulting from sports, because sometimes they have anxiety, stress, injuries. So how can we promote this synergy? Well, with the participation of everybody, because to me it is important. How can we involve safety, culture, health, DIF, CONAVIM, human rights, training, all these sectors? We, as a regulating entity of sports, we want that all the population in general have access and have different alternatives to practice sport, to preserve health and to keep mental health, and to avoid risk factors as those resulting from drug abuse. And for me, the main thing is to talk to all the municipalities and to have a structure with physical activities at the municipal level in the whole country. So maybe our aspiration is to have at least one peace group in each municipality. Thank you very much, Idality. Thank you very much to all the panel members. I think that one of the biggest learns that we had in the health sector to prevent addictions is that communication, to hear the strategy first at the state, municipal, local levels, and that will allow us to have a policy that will change the mindset. I know that most of the attendants to this Congress are health staff, so our work is to be sensitive in the reality of the country in order to make some progress. And in fact, to have a social tissue that will allow us to live free from violence. To have a mental health, we must have a social justice, and that is the job of everybody. Thank you very much for seeing Salis, for this space to talk about this topic that it's something to be proud of to the federal government. Thank you very much, Dr. Abelinda, for sharing these determinants that may favor the context, and mostly from the psychosocial mental health aspects that may allow us to leave behind the criminality resulting in discrimination and stigma, to decrease the community vulnerability, including the social, the civil society that may take care on that nothing can affect about you, me, he, she, and they. There is a huge amount of virtual questions, but the reflection is that the social determinants and the multisectoral contribution regarding this focal part of the population where they use drugs and the chemsex. Thank you very much for your participation, for your collaboration. This table, we are sending you greetings from your house at this conference on health, mental health. And now we are going to start with the next table. Now I am giving the microphone to Dr. Rocio to present as the moderator. Thank you very much. Thank you very much. And now we continue to taking advantage and learning from the speakers that we have. According to the program, I am going to introduce Tessie Corrales Diaz, America, Costa Rica, and she has a master on public health services in Central America. She was the Ministry of Health of Costa Rica, Director of the Inter-American Social Security, the Inter-American Social Security, and 40 years working, teaching in medicine studies. Right now, she is a member of Mental Health Institute in Costa Rica. She will be the moderating regarding the topic addictions in the region and in Mexico. Hello, good afternoon. Special greetings from the members of this panel, Assessment of Public Policies and Mental Health and Addictions in the region and in Mexican, greeting the authorities of the IMSS of the Inter-American Conference on Social Security in alliance with PAHO and the WHO, Olasama. Greetings to the ISSTE and the IMSS Foundation. Thank you very much for this invitation on such an important topic as the assessment of public policies on mental health and addictions. We have been listening to very important speakers where we have a framework which is intensive on the health team, and we have been generating policies in all our countries. In the region and in Mexico, we have been doing an important effort and making a good contribution world level about acting in an interesting way, changing the mental health model, as you just mentioned, toward the moving it toward the community and as a social justice action. This is really very important in order to make an effective intervention. So thank you very much to all the strategic partners collaborating from the different countries and from the different institutions and civil society in order to make an idea exchange, trying to find effective solutions. Especially, we greet our participants in this event in the third edition, doing an effort that was born in the IMSS, supported by the Inter-American Conference, where year after year we have been following all these topics about policies, mental health projects, interventions. This became an exchange scenario where we annually meet in order to get knowledge and to bring our experiences in the best way. This panel, as well as the prior ones, with a dynamic where we will be sharing our experience for 90 minutes with experts from Mexico and from South America, with the participation of 20 minutes. And then we will have the participation of the panel members and then the closing made by myself. The purpose of the panel is to present the results and the lessons learned from the assessments of the evaluation of public policies and mental health presented by the panel members. The public policies and mental health must be the reflection of the reality in the environment, taking care of each context and each environment. We have very complex situations in countries that have, for example, a conflict associated to borderline problems, to war, to poverty, lived by most of the population that is conditioned by the lack of equity, lack of equality and access to public health services. And all of them are considered as social problems resulting in mental health issues. And this is becoming a growing government burden. And this is asking the government to have more tools and to establish more programs. But this is a very important phase of this panel because all the lessons learned must be assessed and improved in order to reach the goal on the long term. It is important to start visualizing, and maybe we will see this very clearly with the experts, and to consider the policies and the interventions, and to determine if this policy meets the requirements and to get the resources to make the assessment.
Las políticas planas en un conjunto de criterios preestablecidos para poder apoyarse y mejorar la gestión pública. Entonces, lograr establecer criterios de evaluación.
To get this assessment criteria, it's very important. It's an important challenge. It's an essential need in order to encourage everything done about the mental health.
Visualizar todo lo que
It will allow us to visualize the challenges for an ongoing improvement for the effectiveness of the policies. We have some scenarios starting by the assessment of the policy, the design of the policy, assessment of the processes associated to all the internal dynamics, implementation, assessment of results, which is complex. We have assessed the impact to see the outcome, assessment of the training that will allow us to get corrective actions for these public policies.
En general, desde, como les digo, desde el inicio, desde el diseño.
In general, since the very beginning, since the design of the policy to assess the implementation and then to determine the diversification, cause and effect. And that will lead us to have an ongoing and effective improvement. We are going to start with the presentations. The first one will be made by Dr. Mr. Curtipeque Cárdenas. He is from Peru. You welcome Dr. Curtipeque in Peru in the development of mental health policies. They have used all the internal and external factors, but they have been one of the countries that provided important lessons. We had an important impact both in building and debate of the mental health policies at a social level, considering important things such as the social economic coalition of mental health, a coalition on biomedics, and also a coalition on
social y discapacidad. El doctor Yuri Inicio Curtipe Cárdenas.
Dr. Yuri Inicio Curtipe is the advisor of the Ministry of Health in Peru. He has a doctorate from the Peruvian University, Cayetano Heredia, master in social politics from the National University, Mayor San Marcos, specialty in psychiatry by the Peruvian University, Cayetano Heredia. He's the executive director of the Mental Health General Direction, Peru Health Ministry, and executive director on research, teaching, and specialized care on collective health in the Institute of Mental Health. Honorio Delgado. Dr. Villu, welcome, and you have the microphone. Good afternoon, Dr. Corrales. Thank you very much for the presentation, the introduction. I would like to thank the invitation by the IMSS, as well as to greet my colleagues in the panel. Yes, as you mentioned, the process for public policies on health, which in Peru were developed in the last years, and I would like to make a summary as an assessment of the process that may be useful to all the attendants. Now I am going to show my presentation. In Peru, as you know, it's a medium-sized country, more or less 33 million people. It has a health system fragmented with two big providers. This is the context of the mental health system. We have the services of the Ministry of the Health and regional governments covering more or less 70% of the population. And the other 30% is taken care of by the salud, which is the labor insurance that form all the population, private services, health from the army and police forces, but they are covering only a small part of the population. We have been reforming it since 10 years ago. We are trying to get universal access to health, but the financing of the system in general is one of the financing with very little amount in South America. Right now, we have a per capita expense of $680 according to the OECD. That corresponds to 50% of what is spent in the region in Mexico. Besides that, we must mention regarding mental health that the reform of mental health is facing the challenges denounced by the people in 2005 and 2009, where they expressed mental health and human rights in the establishments of mental health, specifically the care on psychiatric hospitals, which is centralized in Lima. As a model known in the world, right now we still have this system in some parts just to provide a context about these human rights violation, especially for long-term mentally ill people, and which is just centralized in maintaining the symptoms instead of making or having a healthy life. This resulted in Peru that in 2015 to close a mental health hospital and to replace it with a different type of mental health service called the protected homes. These defensory reports modified the general health law in 2012, where they already have the model of mental health in the community. And in the 2018, they passed the law that involved that provided in the regulation and the development of the multi-sectorial component and the strengthening of mental health organization. In the first reform, in the modification to the health law, they stressed the community health care, hospitalization as a last resource, as a therapy, and to take care of people with mental health illnesses. Then we declared mental health as public interest. We stated the difference between mental and physical health, as well as the involvement of the mental health in all the services, family, community, for the service provision. We also determine mental health service for the development to the community care, as well as to reinforce the implementation of the mental health in the community. In the timeline, in the 2012, the law was modified and modified also the budget for mental health. This law resulted in the financing of mental health services as well as non-communicable diseases, because the budget was used without getting a follow-up of the expenses. In 2013, they approved the budget, and in 2015, they approved the mental health law regulation. In the 2019, the mental health law was approved, making possible that in the 2020, the mental health plan that was implemented during COVID. Which are the achievements that we can mention about the main indicators, both impact and process? Considering this management tool, that was really very important for the establishment of the process goals, such as the strengthening mental health services 2021. That in a certain way, the results were systematized with this document published some weeks ago from PAHO, which is called Progresses and Challenges in the Health Reform in Peru in the last 10 years. This regulation change and these tools for planning had an impact about changing the paradigm of the people suffering mental health illnesses, not only for the health providers, but also for the general population. It means that we started with the paradigm of psychiatric hospitals, centralization of the psychology, and we moved to health services, multidisciplinary care, total recovery, exercise of rights as a tool of social inclusion and the social mobilization. Another qualitative impact was that finally the country has a territory division and about the services to be implemented in each one of the places, reinforcing the first level non-specialized on mental health, and also the implementation of community mental health centers, both focus on the first level of care, as well as the protected homes, protected residences, and rehabilitation centers, working jointly with the hospitals in the territory, with an internal structure, looking forward to have the right profile, but always considering this model of the community mental health based on the needs of people, centered on people and their right to participate in the community integrally, intersectorally, and multidisciplinary. What have we made up to now? Well, we implemented 276 community mental health centers, 49 hospitals, 94 protected homes, 1,434 EESS, of the first level of attention with psychology professionals, 36 attention modules of child misbehavior, 11 itinerant teams on mental health in Lima, as well as 3 jail establishments with mental health services. This took us to show the outcomes of a center. As you can see in this map, the 25 regions lost these red colors and they are approaching to a better coverage with 75% in 133 out of 196 provinces in the country. So it means that most of the population have access to these services.
Conllevado un incremento de los recursos humanos, del equipo multidisciplinar.
This led us to an increase of services, especially in the first level of attention, especially psychiatrists and specialties, language, nursery, mental health, family doctors, and chemical pharmaceuticals.
Ha hecho posible el proceso de reforma que pueda disponerse para
made possible the free distribution to the population with an insurance or with no insurance, with the strategic drugs, because we have 25 formulations up to now.
Formulas until today. From the beginning of the process, we just had one antipsychotic medicine. On the other hand, this has been possible because the investment has grown from the 2015 to 2022. It has grown a 223.7%. And now, currently, we have increased it from 1.4% to the 2.2%, which is not enough, because we know that when we get to the 5% or 10%, the results that we could get to reach to that coverage to the most coverage as possible. On the other hand, this investment is being shown on the orange lines against the blue lines. You can see the differences, which have surpassed the investment percentages with middle income countries, and some others are very developed. For example, the ones that have $20, or for example the Okewa region or the Lima region, which are the ones that have a higher investment. As you can see, this coverage shows a increase that has gone from the 1.9% on 2027 to a 27.6 on 2022. However, the gap is it's too big, because when we hope that when we duplicate these figures, this could decrease until the 13%. Being honest with you, there's no country that could overcome the 70% of coverage, knowing also that the reduction of this attention gap is only possible if we have a perspective of the social differences. But in this implementation of services, we have concrete results. For example, that we have increased the number of psychosis attention cases. As you can see, that in 2014, we had around 30,000. And on 2022, we have more than 100,000 cases. And I mean not only cases, but cases assisted. And another figures that I can show you from this change of the model is related to the psychiatric hospitals or against general hospitals. As you can see, on 2015-17, 16, we have a match on these figures, and the one that is higher is the general hospitals, around 70% on the last few years, than the psychiatric hospitals, which has a 30%. Having these figures, we can close, or this is a figure to close the psychiatric hospital. And what are our knowledges that we have learned? Well, basically, it's that this new model has been well received by the population. This is a model that fights with the stigma that makes people uh, feeling the services and the support that are provided to them to create a recovery, and that also involves the territorial authorities and national authorities that have helped us to develop these services. Currently, these services are done on the first level of attention related to attention services with psychiatrics or community aid, and on mental health hospitals and addictions, also with protected homes. Also, we realize that the progression in infrastructure and human resources was not enough, uh, facing the supply and demand of different services. For example, to give the supplies for a health center that has uh, a lot of people, it was a percentage of one per 100,000 people. Also, we learned that it's necessary to consider new schemes of economic incentives in different areas of specialty of development. Also, we need to recognize that the intrinsic value of these working teams, because we only think sometimes about the anxiety disorders or depressions, but it's also about psychology or psychiatry. But if we wanted to cover all the scope where we have the addictive disorders or the disorders that are long-term disorders, we need a full team to have results in terms of quality of services. Also, there's evidence of the society performance in this new reform. For example, in the community health centers that have contributed to the users' promotion of these community agents or other sectors. And as a result, this has given us different positive experiences in communities to the research of the welfare, collective welfare. To end this presentation, the challenges that we have faced uh, after 9 years of this process are the straining of the mental health services in communities that have been implemented. We needed to improve the mental health services in communities where our poor communities or vulnerable communities, as well as strained community participation of user committees or family committees. We also have pending the implementation of the activities of the Mental Health National Council, as well as the digital mental health services in each territory of the country, with the hand of the implementation of the rehabilitation, psychosocial rehabilitation, and labor. Thank you so much for the invitation, and we're ready for your questions. Thank you, Doctora Corrales.
Muchas gracias, Dr. Cutipe.
Thank you very much, Dr. Cutipe, for your participation.
A todos los actores.
I would like to congratulate you you people in Peru for these 10 years of working so hard, not only on the continuous improvement politics, but also for the resources improvements. We see that there is a challenge in terms of coverage, but I think that with the boost that the system has had, with the participation of different teams and citizens aid, I think this goal will be improved. Also, besides the investment in these systems,
que ver mucho la voluntad política. Ese es
there's
uno de los factores de
also the political will, a great factor to boost
que estábamos
these institutions or these systems. And this is something very important in Peru,
dirigido del
because
2000
when we were analyzing the health politic that was stated from 2012 and 2021, we could see based on a survey, we
y más
took
de un documento
example of
llegó a
countries that were
si nos
improving,
sirvió
and in
ir
some point Peru came to us and it helped us to implement new strategies also. And as I told you, the political will, it's something that needs to prevail, because
si no hay un
no
fuerte
matter how much effort the
si de
health sector puts,
y los
if
actores
there
que
is no political will or different factors, the improvement is not possible.
importante
And
una área
as Dr.
participación y movilización
presented us this information,
el
it was about the community help, and I think that's one of the main fields of this, about the public and private institutions. It's something that could help us to improve the system. So thank you so much, Doctor, and then we will see each other on the Q&A session. Let's move on with the next speaker, which is Dr. Matias Irrasalva. He has a social public master's degree by Harvard University. Currently, he's the regional advisor on mental health and substance abuse on the WHO and WHO, and he has also a degree as a teacher on Chile's university, and he has implemented the mental health implementation plan for mental health on COVID-19 cases. Dr. Matias informs us that
también nos va a hablar sobre la evaluación de las una sesión muy importante.
he will give us an important section that will add very important efforts to the Chile government about the development of strategies and plans to improve the mental health attention, establishing between or among different places of the country to improve the process of mental health care and psychiatric and psychological care. Dr. Matias, you have the word. Thank you so much, Dr. Corrales.
Buenas tardes, ¿me escuchan bien?
Good evening. Can you hear me well?
Se escucha.
Adelante.
Yeah, go ahead.
Muchas gracias.
Thank you.
¿Ahora me escuchan mejor?
Can you hear me better now? Yes.
Muchas gracias a los
Yeah,
por la
we can hear you.
invitación.
Thank you so much to the organizers of this event. Thank you so much, Dr. Corrales, to moderate this panel. And I sent you a warm reading to the other panelists
en el avance, ¿cierto?, de la salud mental en la región.
that help us in this progress in our region. I don't know if you're watching my screen. Are you watching my screen? Yes, we can see your screen.
Perdón, doctor Matías, estamos viendo
Sorry, doctor.
el
We
presentador.
are watching your
Cuéntenme cómo está ahora.
screen. Please tell me if it's working better now. Yeah, it's now working.
Esa es
Okay, so basically,
visión general. Sí, gracias. Una visión
the idea is
del doctor
to
Cutipé.
have like public politics in mental health for the Americas region,
También
to leave it on different countries, but we also need to recognize that for the WHO and the PAHO, we are looking to help different countries, but this means sometimes that we need to educate people regionally, and that's what I'm going to talk about today. I think in this Congress, we have talked about a lot about this, but there's not enough information that we can provide about this, about the mental health situation or substance abuse in the Americas. So that's the forecast of the all ABD causes in the region. We have like an 8.2% of the people that is less than 15 years old who drink alcohol, and sadly, we have seen an increase in suicides for the last 20 years. So, in this sense, we are facing a situation that we need to implement public politics, but as the reason of this panel is about the evaluation of public politics in mental health. These get worse with COVID-19, with a higher range of deaths. We had to close the schools for more than 2 years in our countries, and it brought another important economical and social difficulties. We also need to recognize that we have a difficulty to get resources, enough resources, even when we have a big load, because we have only a 3% of the public expense, which is designated to mental health. And the vast majority of that budget is designated to psychiatric hospitals. So generally, all the countries have a lack or difficulty to spread or to allocate a financing method for different institutions that are not psychiatric hospitals. This generates a lot of difficulties talking about the implementation of public politics, or mental health services are focused on psychiatric institutions in a lot of countries, and around a third of these psychiatric institutions surpass the 5 years in the region. So that means that for the most part of the users that get into psychiatric hospitals will be there permanently. So the risk of this, the vulnerability or the violation of human rights risk of wrong implementation of public politics when we have this accumulation of the services in hospitals. That's why the PAHO in the Executive Congress during 2022 approved the policy to improve mental health. This was approved for the members of this organization, and this was done based on the Action Plan 2015-2020, and this has been working based on emergencies and disasters plan provided from the PAHO, and also for COVID-19. And it's important to mention that at this point, we don't have a higher amount of COVID cases. It's not important. There are some of them. We're still facing the damages of the pandemic, but it's not critical. And as I'll mention in this meeting, I will about the promotion of mental health, the emergency response against the suicides, and the improvement of research. Those are important ideas of this
orientadas a poder
politic for mental health improvement
información, sino
that
que las
will lead us to improve not only the information but also the different countries on the region.
claves de trabajo del punto de
Now
vista
let's move on to the
de cobertura de los servicios de salud
key
mental.
areas of works. Well, the first of them is to improve the coverage of mental health services, because we know that only the 30% of the cases, or on some cases, we have less than the 10% of these people could have access to mental health. So the gap is very high
Es
in
un
the
área
region. We also have, this is an important area to work in to enforce the human rights for those people who have mental disorders.
ya es
In the sense of this strategy, this strategy is coherent with the previous guidelines, and you can download this politic to improve the mental health of the region. There you will find more information about the development of concrete action that would allow us to
como la política,
move forward on this area, because the politics complement this. We can say regulate documents or different frameworks to step forward and sign different politics and strategies of action to improve the population.
algunos logros o avances
There are
que es
some
necesario
achievements or progresses that are necessary to assess, as the panel says. For example, the politics assessment, what motivates us. In that sense, we have tried to raise the national or local agendas, but also there's an area and opportunity that will develop a doctor of our organization, which is the high-class commission report for the Pan American Health Organization, where the ex-minister of Costa Rica participated. And also, we have another commission here that was participating in this for a year to have a recommendations document about how we need to move on in this agenda. Also, this strategy was added on September on this year. With this, we have key documents that allow us to place the mental health on the regional agendas and global agendas. The doctor Rivera will develop different stages of the commission, but I will just mention some of them. One of them are to increase the mental health at national level. We need to improve the quality of the financing, ensuring the human rights, and spreading the information about mental health. We need to improve the services on communities, reducing suicides and reducing the racism, and finally to improve in all of the data and information researches. The second is strengthening on the legislation of mental health. These regulatory documents are important because, for example, the mental health law was approved, and other countries have taken place or have taken the example of Mexico, and they approve different types of laws. For example, the laws of mental health projects, and other countries and members of these organizations, as Cuba or the Dominican Republic, have implemented this, as well as Ecuador, Canada, and Venezuela. We have been developing in action points for mental health in Paraguay and Argentina, which is an initiative that pretends to, or that intends to improve the services and to expand the coverage using a specific methodology that we are using on another 7 countries globally. And basically, this is to increase the professionals on mental health to help us, maybe not specialists, but basically professionals on mental health and improving the digital interventions with different frameworks. This is something interesting that you can review on the PAHO page, so you can see the improvement on this increase of professional health, mental health. Also, it is important to continue with the regional strategy of suicide prevention. And for this, we have taken different actions, but the strategic areas are to improve the politics on multi-sectoral strategies. We know that this is not something that affects health, and we also need to improve the tracking and vigilance for suicides, and also we need to develop prevention strategies for public services to reduce this stigma. Also, in some countries, we have there have been decreasements on suicide rates. And finally, the prevention, alcohol and drugs prevention is something important in the region, and it makes sense institutionally or as a virtual courses in virtual health in the PAHO, and also the cooperation, regional technical cooperation strategy, and some strategies that over the different sectors and strategies that have been done and regionally. I invite you to review the different campaigns. For example, this anti-stigma campaign that was done the last year to reduce this stigma. I invite you to analyze this. If you want to review it, maybe some of them you have already shared it or participate directly, but if not, I invite you to check it out. This year on the Global Health Day, we had a communication campaign, which was pretty strong. One of the politics that was implemented was based on the guidelines. I'm sorry if some guidelines are in English, but it has to be with the implementation plan, and let's hope that the 2020-2030 will bring more guidelines, and also the development sustainable health agenda for the Americas, which I was mentioned slides ago. So basically, these are some guidelines that we are assessing with some countries to move forward in this area. I won't bother you with this content. I think you can review this in the different documents. So if you want to review the different guidelines, but it's just for you to understand how this implementation of politics is done. Moving on to the guidelines, I will talk about the necessity of mental health financing, how much the country is spending on mental health, to recognize that every dollar, peso, or local currency has been invested into depression and anxiety reduction. And it has been very well taken care and implemented because it has been useful to do different works or researches to improve the financing. Based on this financing, we have different frameworks to define the quality of the investment in the instead of the psychiatric hospitals. We would focus on the mainly attention for different communities. We need to look for different mechanisms of financing, internal or external mechanisms that could help us to improve mental health. also in other areas could be ways to improve the financing as in countries of Argentina. I will end up this presentation. Thank you to having me here in this presentation.
Por responder las preguntas que hayan.
I am glad to answer your questions.
Muchas gracias, doctor Matías, por la
Thank you very much, Dr. Matias, for your wild presentation that you have shared with us, in which we have different aspects of really importance, and I think there are some others that have a higher burden, and there are others that are pending on talking, developing, and as you will mention it, those are done by the international organisms. For example, one topic that it needs to be taken care of is that we do not make efforts or enough efforts to make or to grow the financing. Because if we don't have a well-structured program, we won't be able to have a good financing, as you mentioned. So we need to be able to to get in order the system, and that depends a lot on the directory in different countries, because these systems have a higher say in these public efforts or private efforts. And at the end of the day, these are topics that have a lot to do with the government. And also, as you mentioned, the public politics, it's very critical. Another topic that it's important or relevant, which was mentioned, was obviously in all the presentations, is the challenge of the coverage, the reduction on suicide rates. That has a great impact on the human development, because people is focusing on that topic and also on the enforcement of human rights. And you mentioned something very important, that was the non-discrimination campaign. So those are actions that don't need a huge financing, but they have a huge impact, because you can discuss it in every country and everywhere, and this covers a lot of areas of opportunity. Another challenge, very important challenge, is the change of the hospital models into the communitary models, because on these hospital models where people loses his human rights. It's on a system between walls, to say like that. People are controlled there, but we have some training areas there that are very delicate to cover, that are related to the familiar behavior, and that are related to that person who comes from any background. And in Costa Rica, we had experience to help patients that have always been on a psychiatric hospital because family abandoned them, to help them and moving them into a new system where they can at least have more freedom. And also on children, on street cases or addictions cases, that has been very complete work, because it had helped us to make more sensitive people to, at the moment of the assessment, we can have a sense on those populations. So those have been built very well. And now that we are a lot of people on the health service, there is something that pops up on those points, that it's, for example, the financing or the political will. But sometimes we need to go further to share the knowledge on different areas where families haven't been trained or haven't been informed, or those people who suffer from those mental diseases, and moreover, because of what it means to everybody. So those areas need to be covered detailedly. So I think that all of the efforts that have been done are helping us to improve or making an improvement on mental health. And it is very important to say that the emergency and disasters program, because we have seen the impact of the pandemic that they have flipped up the statistics importantly on mental health matter, and that we have a challenge there. So basically, the way that we need to step forward on the mental health agenda, it's very complex, but I think if we work together and based on the technical knowledge, based on the values and principles, if every person in charge works in the right way, we can go further. Also, we're talking about mental health on the politics. It's a strategy of great importance because it's very difficult to find an area that is not determined important. So it's basically a transversal axis, and temporarily it leads us to the importance of the mental health that has proposed the World Health Organization. When we saw it on the first times, it sounded to us pretty strange talking about this.
Y ahora, a raíz de eso, y vamos dándole
Figures.
cuerpo a esta
And now we are building that proposal.
minutos
See
para
you in some moments, Dr. Matias, to continue with questions or answers. Thank you very much.
nuestro tercer panelista. Pues lo tenemos aquí presente al doctor José Javier Mendoza Velázquez. Bienvenido. El doctor tiene una formación académica con maestría en
His studies is a Master on Medical Science
clínica por la Universidad Internacional de Dresden, una maestría en Administración Pública con especialidad en Gestión Gubernamental por la Universidad del Valle de México, alta especialidad en
High specialty in psychiatry by La Salle University, specialist doctor in psychiatry by the National Autonomous Mexican University. Currently, he performs as the General Director of Psychiatric Care Services in Conazama, Mexico, and he is also acting as Director in the coordination of the General Training, Primary Mental Health and Addictions, Coordinator of General Training in MHGAP, Professor of the Medicine School at the Autonomous National University, Coordinator on Clinical Investigations in the Psychiatrist and Mental Health Department, UNAM, and also a Special Care Unit in the Psychiatric Hospital Fray Bernardino Alvarez. Dr. Mendoza, will you welcome? Thank you very much. I am going to share my screen. Thank you very much for the opportunity to see you back here in this forum of health from Acapulco City. We have to talk about emergencies, mental health, and this is what we are covering here. We are part of the care for the Acapulco port that was hit by the Otis hurricane on October 3rd, generating an important damage. So we were called to respond for mental health, and this is a situation I'm taking care of today. That's why I am in Acapulco, in the south of the country. I'm going to share my screen in order to start talking about the topic that we are here for. Just make it full screen. Just please tell me
o si no se está viendo de forma correcta.
Y ya se puede ver.
Muchísimas gracias. Les comento igualmente, bueno, vamos a hablar de las políticas públicas en salud mental. Creo que uno de los puntos más importantes es...
One of the most important things is to make it clear the process where we are right now as a country. The structure that we have for this transformation is looking for a unique regulation on mental health and addictions. We, in fact, before CONASAMA was born, we were participating in mental health from the National Commission Against Addictions. A lot of this work resulted in a model and the creation of a new commission. We said that we must have a unique regulation. Along all this time, one of the most important things for the work in a
lo que ha ocurrido con la geopolítica y el contexto de las sustancias psicoactivas, de manera muy particular para nosotros, por la cercanía
For us, due to the being so near to the USA, this has been very important. One of the most implemented policies a long time is the clear constitution of this observatory of drug consumption that today allow.
¿Qué es lo que está ocurriendo en nuestro país en cada uno de estos momentos? Es importante igualmente que nosotros vayamos viendo cómo cada uno de estos procesos nos ha ido modificando algunas cosas, ¿no? En la situación actual, nuestro país sigue siendo un sitio tanto de transporte, destino y de consumo de sustancias psicoactivas, al ser un espacio que en este momento se ha visto provisto de una gran cantidad de historias. Uno de los puntos más importantes es empezar a trabajar en una política regional sobre sustancias, ¿no? Sabemos de manera particular que si no empezamos a trabajar en una política regional, hablo de las Américas, el problema de las sustancias psicoactivas nunca se va a resolver. Si no, esto es una situación que ocurre en cada uno de nuestros países. Uno de los países ha sustituido al otro y otro a uno en el proceso de la geopolítica. Y creo que es importante para nosotros entender cómo es cada una de estas situaciones se va construyendo. Nuestro país es un país muy diverso y establecer una única política nos permite entender que, bueno, cuando nosotros pensamos que un traje está hecho a la medida para todos, estamos condenados al fracaso. Tenemos que establecer políticas que sean flexibles y que se puedan ir vinculando a cada una de las características que se encuentran en cada uno de nuestros espacios. No es lo mismo nuestra frontera sur que nuestra frontera norte, no es lo mismo Tapachula que Ciudad Juárez. Y en este punto nosotros tenemos que identificar que nuestro país tiene un comportamiento general que lamentablemente no representa a todos los espacios de nuestro país. La cannabis sigue siendo la droga más experimentada, y las sustancias cuyo mayor consumo incrementaron fueron las anfetaminas, ¿no? Esto prácticamente estamos hablando de un 218%, y con respecto específicamente al consumo de fentanilo, uno de los puntos más importantes es que, pues bueno, hasta el momento estamos en un proceso de tratar de entender cómo vamos a lo largo del tiempo a irnos previniendo de que esto no se convierta en una situación crítica. Y hacia eso tienen que irse dirigiendo cada una de las políticas que van a significar el proceso en nuestro país. A lo largo de todo este proceso también es importante identificar que nosotros como comisión, uno de los puntos cuando empezó esta gestión en el 2018, nos enfrentamos a la identificación de una gran cantidad de historias que nosotros le llamamos brechas, las brechas de atención, las brechas de información, pero una de las brechas más importantes era la brecha de la rectoría. La desvinculación que existe prácticamente en todos los países sobre los servicios de la salud mental y los servicios destinados a la atención de los consumos de sustancias psicoactivas nos brindaba una de las principales oportunidades para modificar las estructuras que gobernaban la salud mental desde el contexto de la gobernanza, no de otra forma, para poder involucrar cada una de estas cosas. No en todos los países los trastornos mentales son frecuentes, pero uno de cada 8 de alguna manera sufre un trastorno mental. Y no estamos hablando únicamente de trastornos mentales. Hoy, particularmente en el contexto en el que nos encontramos, y es la razón también por la que es importante nuestra presencia en cada una de las emergencias derivadas de cualquier situación, sea una situación social o sea una situación, en este caso, meteorológica, como lo que ocurrió con este huracán, es importante estar previniendo las consecuencias que han de ocurrir en el proceso de la salud mental. Los problemas de la salud mental igualmente, como mencionaba, no son importantemente presentes en cada uno de nosotros. Sin embargo, a lo largo de todo este proceso, nosotros igualmente podemos ir identificando que, bueno, al final del día, esto no va a disminuir y tenemos que ampliar nuestra capacidad de cobertura, ¿no? El proceso en el cual nosotros nos vamos identificando bajo, o sea, mencionaban, ¿no? O sea, el COVID nos dio una seria cantidad de historias, sin embargo, si no existía el cambio climático, no hubiera existido Otis. Y gran parte de lo que ocurrió con el huracán Otis y el impacto que genera, nosotros los que tomamos decisiones específicamente en el contexto de salud mental, tenemos que saber que los espacios en los cuales nos encontramos con mayor vulnerabilidad van a necesitar una mayor preparación cuando ocurren situaciones asociadas a los problemas de la conducta o a los problemas asociados al comportamiento o incluso los consumos de sustancias psicoactivas. México ha estado de alguna manera tratando de sostenerse en el proceso de la salud mental, sin embargo, hablamos, ¿no?, de que existen unos 20 años en los cuales México decidió permanecer estático en la construcción de políticas de salud mental y de consumos de sustancias. De manera particular, durante estos años, la lucha contra las drogas se hacía de una forma inquisidora, de una forma criminalizadora, e incluso se le llegó a llamar la guerra contra las drogas. La guerra contra las drogas lo único que dejó fue una gran cantidad de números rojos de sangre de muchos de los connacionales que ya no poder, que a los cuales tendremos que seguir recordando como uno de los principales fracasos del proceso de luchar contra las adicciones. Y lo que tenemos en este momento que revertir es identificar que el trabajo por el consumo de sustancias psicoactivas tiene que ser a través de la salud pública. Nosotros, tratando de respetar esto, también tenemos que ir en el proceso alterno, trabajando en un sistema que nos permita identificar cada uno de los procesos, porque un pueblo en el cual sus derechos humanos están cubiertos, muy probablemente sea un pueblo con problemas sin problemas de la salud mental. Es importante que nosotros identifiquemos que cada una de estas cosas, nosotros nos fuimos acercando a esto para constituir una serie de historias que nos permitieran desarrollar una agenda que esperamos que se continúe a lo largo de los años. México, como parte de la Organización Mundial de la Salud y de manera particular como parte de la Organización Panamericana de la Salud, trabaja en específico en estos objetivos de desarrollo sostenible para vincular cada una de las acciones sociales, porque nosotros creemos de manera particular que más allá de ofrecer la salud mental como un terreno asistencial, se tiene que ofrecer como un terreno derivado de la justicia social. Entonces, cuando nosotros empezamos a reconstruir todo este proceso, tenemos que establecer en este plan cada uno de estos puntos, nosotros visibilizándonos como un objeto vigilante del derecho de las personas para poder identificar cómo a lo largo de esta historia y en estos 20 años en los que no se habían construido muchos de estos espacios, el derecho a la salud era negado parcial o totalmente a una gran parte de la población mexicana. Hoy, esto es parte del inicio. No estamos hablando de que la CONASAMA ya es el resultado. Es el primer paso del camino para que el gobierno de México pueda realizar las acciones necesarias para garantizar la atención, una atención de calidad, una atención digna, cercana, y no únicamente geográficamente, sino también de manera cercana en el contexto de la accesibilidad cultural, la accesibilidad para las personas de la diversidad sexual, la accesibilidad en el contexto de género es parte de lo necesario en el proceso de trabajar en las políticas públicas. Con gusto, igualmente, les comparto que la última cumbre, la Cumbre Internacional de Salud Mental, en este documento que publica la Organización Mundial para la Salud, Mental Health, Human Rights and Legislation, esta guía habla de cómo nosotros podemos transformar el ambiente legal de nuestros países en un ambiente identificado como promotor de la salud mental, una ley vestida de salud mental. Y en este documento, como parte del éxito de las políticas mexicanas, México es referido en 5 ocasiones con el proceso de la identificación de la modificación de la Ley General de Salud en el contexto de salud mental y adicciones. La salud mental es un imperativo público, la salud mental, el contexto derivado de la pandemia no nos dejará mentir, Y hoy, estando aquí en medio del desastre que ocasionó este huracán, nosotros sabemos que la salud mental tiene que estar presente no en una política de salud, sino en todas las políticas. Debe estar vigilante en cada uno de los procesos, como lo es prácticamente género, como lo es inclusión. Debemos estar ahí presentes, porque la salud mental debe dictarse en cada uno de los procesos y en cada una de las instancias, gobernación, trabajo, energía. Debe haber un espacio específico para la vigilancia de la salud mental. Nosotros no podemos conceptualizar instituciones que no vigilen la salud mental, porque la salud mental debe ser el trabajo de todos. Al final del día, en gran parte, la salud mental es una de las mejores herramientas para justificar la defensa de los derechos humanos. Y los derechos humanos es lo único que nos va a acercar a países con un mayor desarrollo. En el contexto igualmente, todas las políticas que se fueron dictando a lo largo de ese tiempo, nosotros construimos un modelo, el modelo mexicano de salud mental y adicciones, del cual de manera muy honrada formo parte en el contexto de la creación de este modelo. Y esto lo que busca es que las políticas mexicanas destinadas a cerrar la brecha de atención van dirigidas al acceso a servicios integrales de salud mental y adicciones. Un punto para nosotros es garantizar la accesibilidad económica y geográfica a estos servicios. Y para esto nosotros, en las 341 unidades que contábamos para la atención y prevención de los consumos de sustancias psicoactivas, decidimos convertirlas en unidades que puedan también atender los principales problemas de la salud mental. De manera particular, el integrar la salud mental a la atención primaria es otro de los puntos importantísimos. Bien sabemos que los psiquiatras no nos van a permitir cubrir la totalidad. Digo, yo soy psiquiatra igualmente, sin embargo, somos muy pocos. Necesitaríamos todos trabajar en el servicio público y todos estar dispuestos a movilizarnos a los lugares donde realmente somos necesarios. Sin embargo, esta situación no va a ocurrir y es necesario generar un mayor estado de fuerza, por lo cual uno de estos puntos fue la capacitación nacional en MHGAP, de la cual orgullosamente es muy interesante que yo fui la primera persona que se capacitó para la identificación, para el MHGAP en su versión 2.0, y hoy tenemos a 147,000 personas capacitadas en nuestro país en esta versión del MHGAP. En el proceso de la prevención de los consumos de sustancias, para lo cual normalmente nosotros pues estábamos destinados como Comisión Nacional contra las Adicciones, tuvimos que reformar una gran cantidad de historias, porque la Estrategia Nacional de Prevención de Adicciones tiene como característica un punto importante. La Estrategia Nacional de Prevención de Adicciones no es una estrategia que castigue, aún a pesar de que ustedes escuchen ciertos promocionales. Nosotros desde el lado de la salud hemos defendido el derecho a las personas que consumen a ser escuchadas, a darles audiencia, para que nosotros podamos proveer de los derechos necesarios, ¿no? Sin embargo, todavía es un camino arduo y tenemos que seguir construyendo y esperamos que esta Estrategia Nacional de Prevención de las Adicciones permita identificar las causas y trabajar sobre ellas, disminuir los riesgos asociados a los consumos para proveer a cada una de las comunidades las herramientas necesarias para disminuir los consumos, pero a través de brindarles nuevas oportunidades, no a través de la criminalización. Otro punto importante es la reducción del estigma y la discriminación. El desarrollo de estas estrategias para nosotros ha sido una situación necesaria. Es muy importante para nosotros que la salud mental se normalice dentro del haber latinoamericano. La mayoría de nosotros, los países latinoamericanos, tenemos una gran tolerancia a los efectos derivados de la salud mental. Y es importante que nosotros aprendamos a identificar en qué momento necesitamos ayuda. Y esto va a hacer de manera inherente que empecemos a trabajar en la reducción del estigma y la discriminación. El punto más importante también de cada una de nuestras políticas que está incluido en nuestro modelo es que cada uno de los tratamientos tienen que estar basados en las evidencias y con enfoque en la recuperación. Mucho de la asistencia termina al liberarse de la hospitalización. No significa que el hospital no sea necesario, pero el hospital no es suficiente. Entonces, en la revisita y remodelación, valga la redundancia, porque la remodelación tiene que ser la dignificación también del hospital psiquiátrico, asegurando que brinde atención, pues bueno, que sostenga los derechos humanos. También es importante que utilice esta vinculación hacia los servicios de primer nivel de atención para lograr la recuperación. Otro punto importante dentro de todos estos procesos es la identificación de personas de algunos espacios vulnerables y en riesgo, aún a pesar de que nosotros también les llamamos poblaciones clave. como las personas que están por la libertad, las personas por la libertad, las juventudes, las personas de las minorías sexuales, están incluidas en parte del modelo mexicano de salud mental y adicciones. Estas políticas están de alguna manera acompañadas de los procesos que nos permitan sensibilizar para cada uno de estos espacios. Igualmente, nosotros a lo largo de este tiempo, aun a pesar de que, insisto, es una tarea ardua, queremos cambiar el proceso de la visión hacia una visión de reducción de daños, implementando políticas que se enfoquen de manera particular en evitar la propagación de enfermedades debidas a los consumos de sustancias psicoactivas, prevenir la sobredosis y el impacto que conlleva el consumo de sustancias psicoactivas y asegurar la percepción de la persona como si se le ha de considerar a una persona que tiene una enfermedad cuando hablamos de consumos, se le tiene que ofrecer un tratamiento y el tratamiento no es la criminalización, no es ni la cárcel ni el hospital psiquiátrico. Tiene que ser una instancia social que le permita acceder en cualquier punto y en cualquier momento. Igualmente es importante, avanzo lo más rápido que pueda, por favor. Igualmente es importante que trabajemos en incrementar nuestro número de personal capacitado y de formación en la salud mental. Y esto nos lo ha dado la estrategia para capacitar en MHGAP. Y otro de los puntos importantes que consideramos dentro del modelo mexicano de salud mental es el establecer los procesos para mejorar la calidad de la investigación. Al final del día, para nosotros es importante ir trabajando en cada uno de estos procesos. Y hoy quisiera, como una de los puntos más exitosos de la gestión que hasta el momento se ha construido, no únicamente es la aprobación de la ley en abril del 2022, sino la constitución de la Comisión Nacional de Salud Mental de Adicciones el 29 de mayo del 2023. Esta instancia rectora va a generar una propuesta de políticas cada día que de alguna manera nos permitan ir vigilando a lo largo de todos estos espacios, que se cumpla con cada una de las normatividades en cada una de las instancias dedicadas tanto a la salud mental como en las adicciones. Y desde nosotros también hemos desarrollado esta renovación pues digamos y reactivación de la red de servicios del primer nivel de atención a través de estos 341 centros comunitarios y a través de la línea de la vida, a través de la capacitación en salud mental. Y un punto que también nos decían que no se iba a lograr, ¿no? Dentro de la política nacional, los hospitales generales están, pues, están como se les insta a instalar los servicios de salud mental a través de la identificación de 2 camas sensibles en los servicios de urgencias y 2 camas sensibles en los servicios de hospitalización general, porque la salud mental debe formar parte de la salud en general. El Programa Nacional de Prevención de Suicidio, que hasta el momento ha atendido a más de 40,000 personas y que se replica en el Código 100 en los hospitales generales, la Encuesta Nacional de Salud Mental y Adicciones que hoy corre y nos va a brindar información desde lo clínico para lo clínico y la Estrategia Nacional Juntos por la Paz, porque al final del día estamos seguros que no vamos a lograr la salud mental si no logramos la justicia social, y sin esto no vamos a lograr el desarrollo que esperamos para nuestros países. Muchas gracias.
Muchas gracias, doctor Mendoza, por la excelente presentación y una felicitación, igual que a los otros ponentes, por los logros del país. Creo que CONASAMA ha cumplido una misión muy importante y tiene propuestas a futuro que van a ser muy beneficiosas para la población. Nos quedan 5 minutos de nuestro tiempo. Vamos a intervenir rápidamente cada uno de los ponentes con una pregunta para que nos mencionen cuál es la disparidad que consideran de más peso en lo que es el acceso a los servicios. ¿Cuál es el obstáculo? Palabra al doctor Cutipé y continuamos con los siguientes ponentes.
Sí, doctora, no le escuché bien, hubo una interrupción. Le entendí hasta cuál es la disparidad.
Sí, o el obstáculo mayor que hay para el acceso a los servicios de salud.
Bueno, fundamentalmente,
De salud mental, perdón.
sí, gracias, doctora. Fundamentalmente el acceso geográfico, ¿no? El que los servicios tienen que estar disponibles en el territorio, ¿no? y tienen que ser servicios que estén disponibles con una capacidad de resolución de acuerdo a las necesidades que tienen las personas, ¿no?
Ujú.
Sea enfocada en la persona. Y, por ejemplo, yo soy psiquiatra de niños, ¿no? Y la atención de las personas con trastornos del neurodesarrollo es un reto enorme para el sistema sanitario, ¿no?
Sí, señor.
Y las tasas son altísimas, ¿no? Y cada vez, no sé si pasa en otros países, pero como que en Perú estamos percibiendo que después de la pandemia ha aumentado la demanda para la
Sí.
atención de estos casos de una manera muy notoria y están en todos los territorios y requieren de estos equipos especializados, ¿no? Por eso es que yo aprovecho estos breves segundos para felicitar a los compañeros y compañeras de México por haberse atrevido a integrar en la atención en los servicios de atención de adicciones, ¿no? Más bien la atención de salud mental en general, porque eso les genera posibilidades para generar una oferta de servicios de salud mental adecuada para este tipo de demanda, ¿no? Entonces, de modo que creo que ha sido una gran decisión, pero es fundamentalmente, por lo menos en mi país, está atravesado por una geografía muy difícil. Mi país es un país geográficamente muy arrugado, ¿no? Que requiere obviamente que los servicios estén en el territorio. No son suficientes los servicios digitales porque la propia población no tiene el acceso a datos suficientes, menos si se tratan de problemas como los trastornos del neurodesarrollo que requieren múltiples intervenciones y de plazo prolongado, ¿no?
Sí, señor. Muchas gracias. Doctor Mendoza, vamos sobre la misma pregunta. ¿Cuál es el mayor obstáculo para lo que es el acceso a los servicios de salud mental?
Bueno, muchas gracias. Muchas gracias igualmente a la felicitación que el doctor Cutipé nos hizo llegar. Para nosotros fue un bastión muy importante su trabajo en el desarrollo de toda la política mexicana, por lo cual es un honor para mí compartir este espacio con usted. Igualmente, creo que no nada más es el acceso geográfico. Nuestro país es enorme. Estamos hablando de que somos 32 estados que tienen una cultura que también es muy distinta. Yo creo que para no reincidir en el proceso de la cuestión geográfica, creo que al igual que Perú, somos países completamente distintos dentro del mismo país. Si yo estoy aquí en el sur, en el estado de Guerrero, ayer estaba en Tabasco, la historia es completamente distinta, ¿no? Compartimos algunas cosas, pero el principal problema es eso, no constituir una política pública tan flexible que se pueda adaptar como una membrana a cada uno de los espacios no es una situación sencilla. Ahí destaco la naturaleza del proceso comunitario, que creo que para nosotros es muy importante, ¿no? Cuando nosotros decidimos pues, enfrentar esta lucha, uno de los puntos más complejos era eso, ¿no? O sea, es cómo dictas esto desde un escritorio si no vas a los territorios a ponerle los puntos y las comas para que se entienda de la manera correcta. Entonces, para nosotros este trabajo, y digo, es parte de ese obstáculo, es que la política pública nunca está completamente escrita y siempre tenemos que estar dispuestos a seguirla escribiendo. Nada está escrito en piedra. Y cada vez que alguien venga y te diga, ah, no, es que esto no es como tienes que ser, bueno, entonces vamos a escribirlo específicamente para el contexto. Entonces creo que el obstáculo o el reto es hacerlo comunitario y nosotros los profesionales, incluso desde la toma de decisiones como los psiquiatras, seamos lo suficientemente flexibles para entender que la naturaleza de la salud mental está en la comunidad.
Bueno, rápidamente, a ver si nos podemos comunicar con el doctor Matías con la misma pregunta porque nos advierte que a las 3 nos cierran el Zoom. Faltan unos segundos. Aprovechemos y aprovecho para despedirme y agradecer la participación de todos. Gracias.
Muchas gracias,
Matías.
doctora. Muchas gracias, doctora, a los panelistas que lo escuchan. Solamente reconocer de que efectivamente, como dice el doctor Cutipé, el acceso geográfico es de las cosas más críticas, pero también imagínense para un usuario finalmente poder ser atendido y tener que invertir del propio bolsillo un tratamiento que en general es crónico y es largo. Entonces los temas de financiamiento siguen siendo también críticos. También imagínense llegar al centro de salud a pesar de todas las dificultades de locomoción, del punto de vista geográfico, que no tienen la competencia necesaria para poder hacer una buena pesquisa y tratamiento y rehabilitación de problemas de salud mental. Entonces, en ese sentido, la capacitación de los profesionales no especialistas en salud mental es fundamental. Y finalmente, poder integrar la salud mental, como usted bien decía, en la salud general, es lo que nos va a permitir que aquellos usuarios que logran llegar a los servicios finalmente tengan la atención que requieren. Es decir, que la integración de la salud mental en la atención primaria, en los servicios comunitarios y en la salud general, la red de salud general, es lo que puede reducir los obstáculos. El estigma también es muy importante y es poco reconocido, y quiero terminar ahí y dejándolo reflexionando acerca de cómo modificar estos prejuicios que tenemos en un área que nosotros mismos estamos trabajando. Muchas gracias a todos.
Muchas gracias a todos los participantes, y ya vimos que como factores que dificultan el acceso vamos a tener la geografía, lo que es la parte cultural, que en todos los países se da, y la capacitación, que es el otro eje importante, y tenerlos en cuenta. Y muchas gracias a todos por la participación. Hasta luego.
Muchísimas gracias, doctora Daisy. Le mando un saludo desde esta que ha sido su casa durante algunos años, la Conferencia Interamericana de Seguridad Social. Agradecemos la participación de todos los panelistas que conformaron esta mesa de evaluación de políticas públicas en salud mental y adicciones en la región de México. Y por hoy vamos a dar por concluidas las actividades, no sin antes recordarles que el día de mañana vamos a este segundo eje temático que va a abordar qué se logró y qué falta en materia de salud mental. Vamos a iniciar a las 8:30 de la mañana con la participación de Tania Eugenia Tobar Trejo, y nos va a presentar la estrategia de centros de atención a la salud del adolescente. Les recuerdo que su constancia va a estar disponible el día lunes a partir de las 12 del día. Muchísimas gracias por su participación, por su asistencia, y nos vemos mañana a las 8:30 de la mañana.
Muy bien. Hasta luego.
Hasta luego, doctora.
Buenas tardes.
Adiós.
Hasta luego.